Good morning. My name is James Valentine, and welcome to the externally led, patient-focused drug development meeting for adults with hypertrophic cardiomyopathy. We're coming to you live from the Washington, D.C. metropolitan area, actually not too far from where the U.S. Food and Drug Administration's headquarters are. To open today's meeting, it's my pleasure to introduce Lisa Salberg, the founder of the Hypertrophic Cardiomyopathy Association.
Good morning, everybody, and thank you so much for joining us today, and thank you for the introduction, James. I first want to tell you that this has been a nerve-wracking experience going from an in-person meeting to a COVID time virtual meeting. So we thank you all for bearing with us with the technology issues and all of the planning that's gone into this meeting. I would like to thank our sponsors, Cytokinetics and Myocardia, for their generous contributions to make this event happen. And I also need to thank the staff and volunteers of the HCMA who made this happen. So to begin with, I get to open this up. So with camera nerves and everything, I am here to tell you a little bit about the hypertrophic cardiomyopathy community and why we're here today. The HCMA was founded in 1996. And I am the founder and CEO. Why would I have done that? Well, in 1995, my sister was mismanaged for her HCM, and she died as a result of mismanagement and complications, which actually came from being overdosed on amiodarone, dropping out her potassium and leading to sudden cardiac arrest. That organization has now grown to include 41 HCMA-recognized centers of excellence within the United States. We have over 20,000 families that we have served from 53 countries. We predominantly serve the United States of America and North America, but we do have calls and comments and participants in our organization from literally every part of the world and every ethnicity, demographic that you can possibly think of. I want to explain a little bit about our community, but I will tell you I'm not going to give you a PowerPoint slide presentation this morning. I'm going to talk to you about our community. Once this meeting is concluded, there will be a report issued, and you will see all of the statistics played out in that report, which should be available in the fall of 2020. Number one, I want to tell you that the majority of patients we serve are diagnosed midlife, approximately age 40. However, they can be diagnosed from birth until their 9th decade. So we actually do have patients who are diagnosed at 95 years old. We also have newborns and everything in between. I want to tell you that patients with HCM are on medication for the most part. 90% of them take either calcium channel blocker, beta blocker, antiarrhythmic, anticoagulant, and other medications. 25% of our population has undergone open heart surgery called a myectomy to relieve outflow tract obstruction. 5% of that population has had an alcohol septal ablation, which is an induced heart attack. Not exactly optimal therapy. We're trying to avoid heart attacks in most cases. 30% of our population has an implantable cardioverter defibrillator to protect them from sudden cardiac arrest. And 3% of our patients have had heart transplants. We'll talk more about that later. Our US-based cohort is insured primarily by private insurance by 61%. 30% of our population is Medicare or Medicaid. 30% of our population is Medicare with or without a supplement. About 5% of our population is Medicaid. 3% are federal employees and insured by the Federal Employee Health Program. About 10% of our population is on disability. They're unable to work, and they're normally pretty young. So that's a great burden to our community. Through collections from surveys in our database, we know that 80% of our population is limited from vigorous activities. 60% of our population are limited from moderate activity. 50% of those can't walk one flight of stairs without being significantly discomforted. 70% of the population have a difficulty walking 1 mile. 50% of our population claim that their health is less than optimal. 41% of those people think that their health is going to get worse in the next 5 years. Interestingly, 40% aren't sure what's going to happen to their health in the next 5 years. That insecurity and that uncertainty leads to a lot of stress and anxiety. Patients with HCM have often been told throughout their life that their symptoms of shortness of breath, fatigue, chest pain, palpitations, lightheadedness were not a cause related to their heart, but was in fact anxiety or depression, Well, those physicians were incorrect because the cause of those symptoms were actually the heart of these patients with hypertrophic cardiomyopathy. And that misunderstanding of the disease has led to a lot of mismanagement, inappropriate medication use, and conflicts and concerns when creating new medications because some people just aren't sure what really are the symptoms of HCM and what might be something else. So if we are going to talk about HCM, we're going to hear directly from the patients, and we have a pretty unique way of presenting those patient stories to you today. You're going to be seeing some video segments of patients with their HCM stories, and you're going to be hearing live from some people on Zoom, and you're also going to be hearing from callers and our comments that we're going to read in. But what I want you to know is that these are amazing families dealing with an amazing amount of stress, anxiety, and complications throughout their lives. This is a genetic disorder, and multiple generations of the family can be affected, leading to very complex family dynamics and some psychosocial issues that need to be addressed as well. But I'm going to pivot from the global HCM community now, and I'm going to talk to you a little bit more personally. Why am I here today? You know, what do I have to bring to this other than running an organization? Well, I myself was diagnosed with HCM at the age of 12. And I come from a very long family history of hypertrophic cardiomyopathy. I mentioned at the opening that my sister died in 1995. She was 36 years old and had 2 children under the age of 13, and her little sister was 8 months pregnant. It was a complicating time for our family, as you can well imagine, but it wasn't something new for our family. In 1953, my grandfather died at the age of 43 from sudden cardiac arrest. My father tried to do CPR, but obviously that didn't work. In 1953, we didn't have defibrillators. We didn't have any advanced heart failure therapies that could save my grandfather. A few years later, his sister, my great-aunt, died of a stroke. A few years go by, things seem quiet for a while, and in 1990, I have a stroke secondary to subacute bacterial endocarditis 3 weeks after my wedding. I am partially blind in one eye, and I have residual effects from that stroke. So that seemed bad enough, right? Well, not really. HCM can be cruel. 5 years to the day from my stroke was the day that my sister was pronounced dead after not being able to be resuscitated from her cardiac arrest and having a hypoxic brain injury. That baby that I was carrying, well, she's all grown up now. She's a grad student. She's 25 years old. She had her first defibrillator put in at 10, and her second one put in when she was about 15. We're waiting on that third one shortly. My sister's children, my niece and nephew, both have defibrillators, one due to be replaced this summer. HCM hit me hard too. While I'm trying to run an organization and share the stories of these amazing families, 2016, mine took a turn. After a lifetime of pacemaker, 4 implantable defibrillators, beta blockers, calcium channel blockers, diuretics, antiarrhythmics, and IV milrinone, I gave up my heart. And she left me on February 2nd, 2017, and she's here with us today. She's been plastinized to work as a teaching tool to help teach people about hypertrophic cardiomyopathy. This is a very complex disease, and if you understood where I was right before my transplant, you would never believe that my heart looked like that. Scar burden, stiff, not functioning. So today I sit with a donor heart and transplant medications for the rest of my life, and I am grateful to my donor. Her name was Brandy. Today, we're here to help discover new drugs and help in that development process. We would like better drugs, devices, therapeutics, biologics to help families in the future not have to go to transplantation and not have to live with the burden of heart failure. My family happens to have a myosin-binding protein C mutation. We are the only family to have this particular mutation, and that mutation is ours. There are many other mutations that cause other families problems. While they are combined in being in one classification of disease class, we are all a little bit different, and we need that to be understood. So today, as we look towards the future, we hope that you, the viewers, the members of the FDA faculty, members of drug and biologics companies, understand a little bit more about what the burden of disease is for those with hypertrophic cardiomyopathy, and that you understand that these families are amazing. I call them my HCM warriors. They are dealing with a lot of complexities, and they need your help. They need drug discovery, and they need you to listen to us and hear that we're willing to take some risks. We're willing to get into the foxhole with you and look for new drugs, and we understand it comes with some complications and some work on our part too, and we're happy to be working with you in that role. And today we're going to learn a lot more about what these families deal with. I hope you gain a better perspective on the burden of HCM and we can work towards better drug discovery. And I'm really looking forward to this day. And now I'm going to be quiet for most of the rest of the day, and I am going to hand the microphone and the Zoom camera over to Dr. Preston Dummon, who is the acting medical team leader of the Division of Cardiology and Nephrology for the Center of Drug Evaluation and Research at the U.S. Food and Drug Administration. Good morning, Dr. Dummon, and welcome, and we're looking forward to your opening comments.
Lisa, thank you so much. And on behalf of the U.S. Food and Drug Administration, I'd like to thank the Hypertrophic Cardiomyopathy Association for inviting FDA to participate in this patient voice session today, as well as all the HCMA staff that I know has been involved in planning this complex virtual meeting. But most of all, I want to thank you all for being part of this meeting and being willing to share your experiences with us. I know we have representation from industry, academia, and other medical product development stakeholders in this web meeting. FDA plays a critical role in medical product development, but we are just one part of the process, and I'm glad to see a high level of interest from those of you who also play an important role. FDA shares the patient community's commitment to facilitate the development of safe and effective medical products for hypertrophic cardiomyopathy. And when we say medical product development, we mean it in the broadest sense of identifying, developing, and evaluating not only potential drug therapies, but also device therapies that could help you, the patients, manage your conditions. FDA protects and promotes public health by evaluating the safety, effectiveness, and quality of new products. But we do not develop medical products, nor do we conduct clinical trials. However, it is the FDA's responsibility to ensure that the benefits of a product outweigh its risks. And by benefits, we mean that a product improves how a patient feels or functions or improves their survival. Therefore, this kind of dialogue is exceptionally valuable for us because hearing what you, the patients, care about can help us lead the way in figuring out how to best facilitate medical product development for hypertrophic cardiomyopathy, and more importantly, to understand how you, the patients, view the benefits and risks of therapies and devices for this condition. We look forward to incorporating what we learn here today into the agency's thinking and understanding of how patients view the benefits and risks of the therapies and devices for HCM. Once again, we are here today to hear the voice of the patient, so thank you for your participation. We are grateful to each and every one of you for being willing to be here today to share your personal stories, experiences, and perspectives with us. And with that, I'd like to turn this back over to Lisa.
Thank you very much, Doctor. We are going to now hear from one of our medical directors of the HCMA and board member, Dr. Maron, who is the director of the Hypertrophic Cardiomyopathy Institute at Tufts Medical Center up in Boston, as well as co-director of the Chanin Mast HCM Center in Morristown, New Jersey. Good morning, Dr. Maron.
Good morning. Thank you, Lisa. I want to also thank everybody at the HCMA. Also thank Dr. Dummon and also the key members of the FDA, as well as the patients who will be telling their story today, their incredibly important story today. It's an honor to have the opportunity to join you today and provide really an overview. And this is what there's going to be, a brief overview of HCM that will help put, I think, the conversations that are going to occur today into context as well. So let's start with the first slide, which is the definition of HCM, hypertrophic cardiomyopathy. It's increased wall thickness of the left ventricle, the left lower chamber of the heart, in the absence of another cause like high blood pressure or aortic stenosis or other diseases like metabolic or other multi-organ syndromes that can also cause LVH or hypertrophy of the left ventricle. So you can see on the bottom left here, this is a disease of mutations of the sarcomere, the structural apparatus of the heart muscle. 13 different genes encoding these proteins of the heart muscle, and there are now over 3,000 different mutations within these 13 genes that cause HCM. Many of these mutations, as you've already heard, alluded to, are what we call private, unique to specific families. Go ahead and advance. In addition, there are patients who have no genetic mutation identified and also have no other cause to their left ventricular hypertrophy who are also considered to have HCM. And so this is the definition of the disease that we're going to be talking about today, HCM. With that said, I want to just make one point. Go ahead and click. There are also adults who have increased wall thickness that are genetic heart diseases that are due to other causes, non-sarcomeric mutations. These are lysosomal or glycogen storage diseases that look like HCM but are completely different. AMP kinase, LAMP2, Danon, and Fabry disease are three examples of those metabolic or storage diseases. These are uncommon but really important diseases, but are not going to be the focus of the discussion today. Next. So this is the representation of the cardiac sarcomere, again, the protein structural apparatus of the heart muscle. Just wanted to show you the location of the different mutations that cause HCM. Beta myosin heavy chain and myosin binding protein C are the two most common genes responsible for HCM. Next. And this is what HCM looks like through, in this case, the eyes of what we call advanced cardiac imaging, MRI. MRI, the blood is bright in the heart muscle, the left ventricle is dark. And what you can see here is really 6 different patients with HCM and the incredible diversity of what we call the phenotypic expression, the expression of left ventricular hypertrophy. The location, the extent, and the distribution of this increased wall thickness is incredibly varied. It's probably because there's so much heterogeneity of the genetic cause, and that's the result of why we see so many different expressions of this disease. You can see here, upper left, increased wall thickness of the septum. Here, the posterior septum is thick. You have the lateral wall being thick with sparing of the septum. You've got apical, meaning hypertrophy of the distal portion of the LV cavity, diffuse. Even in the bottom right, very focal and limited increased wall thickness in the presence of completely the rest of the heart being normal thickness. The point here, that I want to make is that this is all HCM. It all gets lumped together under one diagnostic roof, HCM. Go ahead and advance. What is important in particular when we talk about how to manage patients, though, is to group them into 2 different distinct hemodynamic categories. On the left is the more common. 70% of patients with HCM have the obstructive form, where blood flow out of the heart is obstructed by the mitral valve, gets in the way. It's like clamping down on a hose. And in this case, the blood backs up into the left lower chamber, and that causes increased pressure in the heart, as well as regurgitation of blood back up to the left atrium. And together, those 2 issues, high pressure and mitral regurgitation, are perhaps the most important reason patients with this disease incur limiting, frustrating symptoms in their daily life. On the right is the less common. 30% of the population with HCM have the non-obstructive form, where there is no impedance to blood flow out of the heart. And in these patients, symptoms is less common than the obstructive, but when it occurs, it's due to abnormalities of myocardial relaxation of the heart muscle, what we call diastolic heart failure or diastolic dysfunction. Next. So why are we here today? Why does HCM matter? There's a couple bullet points that I think support this answer. It's the most common genetic heart disease we have. I'm going to show you in a minute, the next slide, what I mean by that. Heterogeneous, as I've said, meaning really diverse in how it's expressed with wall thickness. That also translates into a lot of diversity in the clinical course, what happens to patients. And we'll talk about that in a minute too. Most common cause is sudden death in young patients, including competitive athletes. It's also a common cause of heart failure symptoms, limiting symptoms, and stroke for patients of any age with HCM. And importantly, the average age of diagnosis for this genetic heart disease is midlife, mid to early 40s, meaning that many, many patients are living decades with this disease. And important cause of symptoms, and again, it really have to be clear here that whether you have the obstructive versus the non-obstructive form, because the treatments are different for symptoms, and we'll talk about it in a minute. Next. To just kind of hone in a little bit more on detail about how common HCM is, I want to draw your attention to the kind of the middle of the slide, this box. 1 in 500 is the general accepted prevalence. That means that if you literally take people off the street and you did echocardiograms, on them, 1 in 500 would meet the clinical definition of HCM with increased wall thickness. And that's supported by a number of what are now kind of older epidemiologic echo-based studies all around the world showing, again, the same prevalence of 1 in 500. Next. However, I think it's been, I think appreciated that it may actually be more common than that, upwards of 1 in 200. And that's because we've evolved in how we can, the reliability of diagnosis. We've got better imaging techniques, MRI with really high spatial resolution. And if you take into account that for each person diagnosed with HCM, there are likely multiple affected family members, you could be talking about 1 in 200 for this disease in the general population. If you take the more conservative 1 in 500, you're looking at about 750,000 people in the US with HCM. The number of actual diagnosed patients, though, is much less. It's more on the order of 120 to 150,000. That's because most patients with HCM are actually unrecognized and not diagnosed, what we call under the surface. Next. So patients say, when we see them, okay, if I have HCM, what can happen to me as I go through life? And I think one of the first important points to make, go ahead and click next. At the top of the slide, one of the first things we discuss is that many patients remain asymptomatic and low risk for their whole life. That doesn't mean that they go off into the sunset. We follow them closely because things can change. But of course, there are really important, what we call subgroups of patients with HCM who are at risk for adverse disease-related events, including, of course, the most catastrophic and highly visible sudden cardiac death, heart failure with obstruction, heart failure with non-obstruction, and also atrial fibrillation and stroke. One major point is that we do now currently have what we call in the current contemporary cardiovascular era, treatment era, drugs and devices that are very effective at addressing and treating each of these different pathways if a patient happens to go down them to improve how they feel and also to extend longevity. Next. To underscore that really important principle is this slide. It's a busy slide, but just the important point is just to come to the bottom here where it says HCM, and the number next to that is 0.5%. That's the current mortality, death rate due to HCM, 0.5% per year in the current era with all of the modern cardiac drugs and treatments and devices. The point is that number is very low particularly compared to other non-cardiac diseases like all cancers, which is about 6% per year mortality, and also other cardiomyopathies like dilated cardiomyopathy, which has an annual event rate for mortality, again, which is 6-fold greater than HCM. And so the point here is that although mortality is low with HCM, which is very good, that means patients with HCM are living longer. Normal life span. And that means that they can incur morbidity issues of symptom burden, which are incredibly frustrating and debilitating, and which you'll hear a lot about today from the patients. That also means that as new therapies come available or are being evaluated, we have to remember that we're talking about long periods of time that patients are exposed to these symptoms, so that therapies have to not only be efficacious, but they've got to be safe, of course. Next. So let's just talk a minute in the last 2 or 3 slides just about exactly what we mean by the unmet need, treatment need in this disease. And again, you've got to talk about it in terms of the 2 hemodynamic groups. Obstruction first, again, 70%, the majority of patients. And if you just look at a large number of obstructed patients at any one time, about 40% have symptoms that frustrate them despite current therapies. And some of those patients will progress over time with this arrow to more advanced symptoms. It's true we have current invasive therapies that can improve significantly those symptoms at that time, but these are invasive options. They, of course, carry a small risk, and their availability can be limited, particularly if you're talking about on a global level. So next, that means that the unmet need here really is new therapies that can improve the morbidity, the feel, and the function, as you heard before in this group, in addition to the current therapies, but also therapies to prevent development of going this direction to more worse symptoms, and potentially in that way avoiding or decreasing the chance or the need for invasive therapies. Next slide. In the non-obstructive, similar kind of story. You got 25% of patients who are sort of frustrated with how they feel on current therapy. Some of those patients, again, will progress to feeling worse. If they get really bad in non-obstructive HCM, the only good long-term option in those patients is heart transplant. I'm sure you're going to hear about this as well today, but that's obviously a huge deal. Heart transplant carries with it, risks, of course. And so if we go ahead next, if we have a new therapy here, the unmet need is to improve here the symptom burden on top of what's available, but also, and perhaps most importantly, to prevent progression in this direction to avoid, hopefully someday, the need for advanced heart failure therapies like transplant in all the patients with HCM. Next slide. The 2 slides left. I just want to talk just 1 second. We just talked the last 2 slides about symptom burden, the feel, but I also want to talk about that as it relates to arrhythmic burden. The 2 important arrhythmias in this disease are atrial fibrillation, AF, and ventricular tachycardia to the right. Atrial fibrillation, 20% of patients with HCM will develop at some point 1 or more episodes of atrial fibrillation in their lifetime. And the combination of AF and HCM is a bad combination. Patients feel terrible with that combination. And current antiarrhythmic drug therapy is limited here because of the side effects of many of those drugs, including amiodarone. In fact, it's really not possible for those reasons to use those drugs oftentimes in HCM because of the young age and duration of time that patients would be exposed to the side effects of those drugs. And of course, there's a risk for stroke as well related to AF and HCM, which is quite high. Sudden death, fortunately, today is a very low event rate. Perhaps the greatest unmet need here in the ventricular arrhythmia group is that we have some small but important degree of over-treatment with the ICD to protect patients from sudden death. It would be one unmet need there. And the point there is that those patients they have an ICD that never experience an appropriate shock, are still exposed to the long-term risks of indwelling device therapy. So it would be great as an unmet need to decrease this as well in the future. Next. I'll conclude with this slide, just showing you the unmet need in HCM by kind of increasing priority left to right, at least in my view. This has to do, again, not with mortality, which is very low, fortunately, but it has to do with exactly what Dr. Dummon was saying, feel and function, the impact on how patients feel and how they function. Limiting symptoms due to obstruction. The invasive options are very good, but they carry a risk and they're limited in accessibility. We've talked about arrhythmic burden, and current drugs have side effects that limit their applicability to this patient population. You've got refractory heart failure and non-obstructive and heart transplant, which carries enormous risks to it as a therapy. And of course, the greatest unmet need, at least in my view, is the non-obstructive symptomatic patients for which there really is no disease-specific or targeted therapy, and therefore these patients remain frustrated despite that. I'll end there. Thank you again. It's an honor to be involved, and I appreciate very much your time. Thank you.
Dr. Maron.
I'll turn it back right now to Lisa. Thank you.
Thank you, Marty, for that wonderful presentation. Handling all aspects of HCM in just a few minutes is really a challenge, so thank you. I am now going to pivot and turn this over for facilitation to James Valentine, who started this program. But I want to tell you a little bit about who James is and why it's important that he's with us today to help us guide through here. Number one, James has been working as a patient champion for over 12 years. He started his career with the FDA, and he has ventured off of the FDA into private industry to help organizations like the HCMA build patient-focused drug development meetings, which is really helpful because he created the infrastructure and now he's helping us run these meetings. And he's been a delight to work with through this entire event. And when we announced our new date for PFDD of June 26th, he and I spent this day together a year ago, and when we both realized it was my mother's birthday and his. So happy birthday, and I turn the microphone to you.
Oh, thank you so much for that introduction, Lisa. And, can't think of a better way to spend my birthday than, helping this community bring its voices to drug developers and the FDA. So now that we've heard from an expert from FDA, as well as a clinical overview from a disease expert, now we get to turn to the core of today's meeting, which is to hear from you, patients and direct caregivers of patients, whether you're a spouse, a sibling, other loved one, about the experiences of adults living with hypertrophic cardiomyopathy. As you heard from Dr. Dummon, PFDD is a more systematic way of gathering patient perspectives on their condition and on available treatments, and that your input can really help inform the agency's understanding of HCM to inform drug development and review. You should know that so far, FDA has held 26 of its own PFDD meetings, and today marks the 34th externally led PFDD. And due to the ongoing COVID-19 pandemic, it's actually the second ever fully virtual patient-focused drug development meeting of its kind. So today's meeting is meant to be interactive. So I want to tell you and orient you a little bit to what we'll be asking of you throughout the program and session to provide your voices. First, in terms of the kind of topics we'll be covering, the first thing we're going to do is explore the patient and caregiver experience with living with HCM and its impacts on your daily life. Then second, we're going to build on that and explore the various approaches to treatment that you currently have available, as well as ask about your preferences for future treatment and regarding participation in clinical trials. So what will that discussion actually look like? Well, the first thing that we're going to do is hear from panels of patients and caregivers that are living with HCM. They're going to share their experiences and set a good foundation for our overall discussion. Those panelists were selected to reflect a range of experiences with HCM. Certainly they don't reflect the full range, but our goal there is to get the conversation started and to begin to hear from a diverse set of individuals. We're then going to build on that panel discussion by opening it up to you all to share your experiences and your preferences. So any patient and caregiver that's tuned in today is invited to participate. I'll be asking you questions and inviting you to provide a comment. And you'll have one of two different ways to do this. We will have a way for you to dial in by phone or to submit a written comment. And I'll remind you along the way of how you'll be able to do that. And at the same time, we also have a panel of invited guests on Zoom, also patients and caregivers who will be sharing their experiences. Throughout that audience discussion and throughout today, actually we'll be getting to one of these sets very soon, we'll be using live polling. So we encourage you, if you're following along on your computer, to maybe pull out your phone, or you can also open up a separate tab in your browser. And we'll be giving you instructions on a web page to go to where you'll be able to answer live questions. Patients and caregivers, these questions are for patients and caregivers only. And so we plan to use those questions to help broaden the discussion and ensure that we can get everyone to provide some input. We should also note that while we hope to hear from as many people as possible today, there will be an opportunity to continue to provide input in writing after the meeting, and we'll give you instructions on that at the end of the meeting today. But I want to just let you know that all of today's input, including any written input, will be summarized in the summary report, which is called a Voice of the Patient report. And that report, as Lisa mentioned, will be provided to FDA as well as be made available to researchers and drug developers. One last thing before we get started, I just want to share some ground rules for today. We encourage individuals with hypertrophic cardiomyopathy and their caregivers to contribute to this dialogue. The dialogue is limited to those individuals. This is our time to hear from patients and caregivers as experts in their disease experience. Our other stakeholders, including FDA, drug developers, and clinicians, are here to listen, and so they'll be tuned in throughout the day to hear from you and learn from you. The nature of the questions we're asking, they're inherently personal, and the discussion at times may get emotional. And that's okay, but it is important to note that we do ask that you respect one another. And to that end, we ask that when you are providing your comments, you try to be focused and concise. That way we can have time to hear from as many voices as possible. So with that overview kind of out of the way now, we'd like to go to our first set of getting your input, which is to try to get some information about the demographics of our patients and our caregivers that are participating today. So if you can pull out your phone, open up that new tab, and at the top of what you'll see at the top of the screen here is the URL that you'll type in. It's pollev.com/4 HCM. So again, that's POLLEV.com/4 HCM. This is the same slide or website that we'll be going to throughout the full program today to get your input. So for our first question for you on demographics, we just want to get a sense of our breakdown of our patients and our caregivers. So we want to know here, A, are you an individual that is living with HCM? Or B, are you a parent or a legal guardian or other caregiver that's answering on behalf of someone who's living with HCM? Now, I should note that if you both are participating today, that's okay. We'd love to hear from both of you, as we know that sometimes you may have different views and perspectives about the HCM experience. So I'll give you, everyone, since our first question, give you some time to load that web page, pollev.com/4 HCM. It's still posted here at the top of the slide that you're seeing, and ask you to respond, are you A, an individual with HCM, or B, a caregiver, whether a parent or legal guardian or other loved one of someone living with HCM?
Some of them are going to be both. So you have to pick one for this particular question. Other questions you'll be able to give multiple responses.
Yes, and so for that, to that end, if you are a individual with HCM, as well as a caregiver of someone, please respond to A, you are an individual living with HCM for this particular question. So while results are trickling in, I think it's fair to say that the vast majority of our participants today are individuals living with HCM. However, we do have participation from our caregivers as well. So if we can move to our second polling question. So here we want to ask you, where does the person with HCM live? So if you're the individual with HCM, answer where you live. If you're a caregiver, where does the person you care for live? It's most likely the same place where you live, but maybe not. So we have a number of response options here for you. Select the one that best fits where you live. A, the U.S. Northeast. B, the U.S. Mid-Atlantic. C, the U.S. Midwest. D, the U.S. South. E, the U.S. Mountain Region. Or F, the U.S. West. Then outside of the U.S., you can answer G for Canada, H for Central or South America, I for Europe or UK, J for Asia, K for Africa, or L for Australia or New Zealand. We'll just give you a few more moments here. Pick the place, best representative of the options here of where the person with HCM lives, if that's you or your loved one. So as it stands, just over 40%, so a little under half of our participants are located here on the East Coast. However, we do have good representation across the Mid-Atlantic, the Midwest, and the South, as well as the U.S. West. We also have some participants from Europe or the UK, as well as Asia. So we go to our next polling question. So here we just want to know, is the person with HCM that you're representing today, whether it's yourself or your loved one, are they A, male, B, female, or C, non-binary, or gender non-conforming? So give you a few moments to answer these. I promise the polling questions in the future get a little bit more complex, and this is the basics. We want to know who we have with us today. It's great kind of foundational kind of understanding of who you all are, but we'll really be digging in and wanting to know your actual experiences with the disease and with treatments and preferences for treatments in future polling questions once we get this stuff out of the way. So as it stands, it looks like we have about a little under 2/3 of our participants are representing persons with HCM that are female, and then a little over 1/3 that are male. Next question. So here we would like to know the current age of you if you're a patient, or of the affected individual if you're a caregiver. So your options here are A, under 18, B, 18 to 30, C, 31 to 40, D, 41 to 55, E, 56 to 70, or F, if over 71 years of age, or 71 and or greater in age. All right, we'll give you a few more moments to go ahead and get your response into this question. Just as it stands, since it kind of looks like the rankings are standing fairly stable while results are trickling in, it looks like our greatest representation are those in the 56 to 70 year age range, followed by about 1/4 of people in the 41 to 55 age range. We've got actually a good chunk of individuals representing over 10%, representing patients that are age 71 or older. And then after that, the 31 to 40 year age range, as well as we do have representation from those younger age ranges. If we go to our next polling question. So now that we know your current age, we'd like to ask you, what age did you or the affected individual first have symptoms of HCM, if you know? So A, was it between first symptoms between age 0 to 5, between age 6 to 18 for B, C is between age 19 to 30, D, age 31 to 50, E, age 51 to 60, or F, first symptoms were at greater than age 60, or G, if you are unsure at which age you or your loved ones first had symptoms of HCM. So we'll give you a few more moments to respond here. It looks like we got a little bit of competition at the top between the 6 to 18 year age range and the 31 to 50 age range.
I'm not surprised.
With the third being in the 19 to 30 age range. So kind of really, if you look at that almost as a block, kind of that, not the earliest of childhood, but childhood through age 50. There's a wide spectrum of the vast majority of people that experience symptoms in those categories. However, there are people who didn't experience symptoms until they were in their 50s, their 60s, and beyond. And very few are reporting here today that they had their first symptoms in that early childhood range. And I think it is worth noting that there is a group, about 5% of people, who aren't sure when first symptoms happened. So if we go to our final demographic polling question, please. So our question here, the last one, we wanted to know what age did you have a first symptom, but we know that's different, not always the same as when you were first diagnosed. And so here we would like to know the age at which you or your loved one were actually diagnosed with HCM, and the same options apply in terms of early childhood, late childhood, early adulthood, mid late and maybe we'll say extra late adulthood in the 60 plus, the mature adult population. And then, of course, if you are unsure, please select G.
Again, no surprises here.
I think what is interesting of what I see so far is one of the top groupings in the symptoms was the 6 to 18, and yet there's a big drop off to where clearly those must have been diagnosed later. So you should see a shifting kind of the curve to the later ages here. I think maybe confirming what we would have guessed, which is that it takes quite some time to get that diagnosis, even from the time of first symptom.
It's interesting in that earlier age group, when they come up with some symptoms, they're often told that they have athletically induced asthma, an innocent heart murmur, or it's psychological. Mm-hmm. And it takes 20 years to get to diagnosis.
Sure. So as it stands, it looks like the greatest portion of our population for getting diagnosis was in the 31 to 50 year range. After that, it's fairly kind of near equivalence between 51 to 60, 19 to 30, and 6 to 18. No one reports getting diagnosed in the 0 to 5 year range, and there is a small grouping that are slightly less than were unsure about when they had their first symptom, that were unsure about when they got diagnosed. So that concludes our demographic polling. Thank you so much for participating in that. We want to get that sense of who we have, but now we get to what I would say is really the good part. We want to actually start hearing from you all, and we're going to get into that first topic now. So this first topic that we're going to be working through up until the lunch break is living with HCM and the symptoms and daily impact of living with HCM. In this session, we're going to do a number of things, questions we're going to try to accomplish, understanding what are the most significant impacts of the disease on your life, how those symptoms manifest and how they might vary over time, whether that's on your best or worst day, or if they vary maybe day to day or week to week or month to month or even over the course of years. We're also going to be asking about the different activities that are important to you and how those are affected by the symptoms and health effects of HCM. And then finally, knowing that not all symptoms and impacts are truly experienced on a daily basis, but that there is a disease progression here. We want to know about your fears and your worries and your frustrations that relate to your disease as you get older. So to start us off on this topic, we have a panel that will be sharing their pre-recorded videos with you. We have Linda, Rush, Priscilla, Cole, and Derek. So I will turn it over to our first video, which was of Linda.
No, it's cool.
When you are a kid, you feel invincible. My name is Cole Mitchell, and I am 25 years old from rural Pennsylvania, just outside the city of Reading. Ever play Monopoly? That's our railroad. Before I get too far into it, I want to thank the HCMA for their work in giving us this opportunity to share our stories. I grew up with a single mother, as my father had passed away before I was born due to complications from a kidney transplant after a heart transplant. My mother was my rock growing up, still is, so when I was diagnosed at age 12, it was her support that made it easier. It was discovered during a simple, routine, yearly well visit. My pediatrician heard a heart murmur, so I was sent to get that checked out. What ensued was a journey that took me to multiple doctors spanning 3 states. I went to a few different places while they figured out exactly what it was, and I eventually ended up 350 miles away at Tufts Medical Center in Boston, before moving to Allentown, Pennsylvania to be closer to home, and then finally following my doctor to Morristown, New Jersey. When I was diagnosed, I did not believe or understand what was happening. When you are a kid, you feel invincible, climbing trees and jumping down instead of carefully getting back down just because you can. I was told I had to stop playing sports, which was not much of a bother since I did not play sports growing up. I had been involved in the scouting program since I was 6, so being able to continue that was one of my biggest concerns. Luckily, I was able to continue, and was able to make it all the way up through to Eagle Scout, but that's another story entirely. When I was 15, 3 years after diagnosis, I was advised to get an implantable cardioverter defibrillator, or an ICD. Again, kids feel invincible. And even knowing what I knew, which when you were 15, you think you know everything, I did not want one. It was only after talking to people who cared about me, and also with someone who is my age who had one, that I decided it was a good idea to get one. 6 months later, I received an appropriate shock that saved my life. Had I not gotten one, I would not be here to share this story. I had just fallen asleep, and I did not know what happened until my mother received a phone call the next day. I vividly remember the voice on the other end of the phone telling my mother, if he had not gotten one, you would be planning a funeral right now. What a terrifying thing to hear as a 15-year-old, but it is just one of the ugly truths of HCM. Looking at me back then, and even today, you would not be able to tell that I have a heart condition. My life has been impacted by HCM in multiple ways. I have been taking medications twice a day for nearly 15 years. It has narrowed the career choices that I could have made. A lot of kids say they want to be a police officer or a firefighter when they grow up, or join the military, but those were options that I just simply did not have. Even with these limitations and differences, I'm able to maintain a positive outlook on life, and I've used my unique perspective in my chosen field. I go to bed happy, and I wake up happy, knowing that I have the opportunity to do so, unlike others who went before me that were unprotected by an ICD. I guess that is why I've always had a penchant for helping others. My experiences with the condition also led me to get a degree in social work. I've been able to take my unique perspective on life to my work. To truly understand adversity, you first need to deal with it yourself. And I have. I know what it is like to have someone look at you and say, there's nothing wrong with you. Stop faking. I wish I were faking, and I want others to be believed as I should have been. I applied the knowledge and skills I've obtained in life and formal education to getting a career with the Boy Scouts of America as a district executive, which is a member of their field staff. While not as hands-on as some other careers in the social work field or with the Boy Scouts of America, it helps me help others without endangering myself or others as a result of my physical limitations. Another aspect of life this condition affected was my relationship with others. When diagnosed, I had a few concerns. The two main ones being, can I continue Scouts? And what will my friends think? Will I lose them? Who wants to hang out with someone who is broken? The biggest outwardly apparent factor was that I could not run in gym class or go on high adventure trips with the Scouts, which was difficult, but quickly just became a fact of life. While I have far fewer symptoms than others, I want to tell you about some of the worst days. It is still frustrating to have to say, I'll catch up, or, hey, I'll wait here. The most frustrating part is that every day is different. Some examples that happen frequently is having to catch my breath after one flight of stairs that I could run up the day before, or hike 5 miles around a local lake one day and be exhausted from simply walking 500 feet to the mailbox the next. But what I really want you to know is that I just want the bad days to end. I'd like to tell you about 2 situations that occurred. One while working in a deli, and the other while walking around the aisles of Walmart. In both cases, I began to have palpitations. I started to get tunnel vision. As this was happening, I was scared. I was scared of several things. Scared of what was happening physically, and scared of what would happen if I did pass out. Would those around me know what to do, especially since I don't look the part? I just want the bad days to end. I hope new therapies could be developed to help end these bad days. I appreciate you taking the time to hear from us today, and I hope you all have a wonderful day.
My name's Rush Roberts. I'm 41. I'm originally from Bandera, Texas. I live in San Antonio, Texas right now. I was asymptomatic. I only got tested because my dad had the condition. The scans revealed a slight thickening near the valve muscle, so I started an intense routine that lasted about a year. Stress tests, MRIs with dye, CAT scans, EKGs, ECGs, Holter monitors, anything you can think of. I didn't like it at all. I was in my early 30s and I felt okay. I lost a little bit of weight just to be safe. I wasn't in peak condition by any means, but I wasn't in terrible shape. After about a year, I was really hating it. Not the actual condition, but the constant barrage of tests and appointments. Being a guinea pig for everybody to listen to my novelty heartbeat. Getting poked and prodded for labs every few months. Before I knew it, a year had passed since my last checkup, so I finally went back to the doctor. I was an AFib, and they sent me straight to the hospital because I was in the early stages of heart failure. I spent that night in the ICU waiting for my blood pressure to come down enough for them to cardiovert me out. I got lucky. Further tests would show that the thickening had grown, so we decided to go ahead with surgery to alleviate the extra pressure on my heart. This was about 3 years after my first diagnosis. So 5 years ago, I had a myectomy at a high-volume center of excellence. After cardiac rehab, I was back to work within a couple of months. A year after surgery, I was in the best shape I'd been in for over a decade. I lost about 30 pounds since the operation. I was going on 8-mile hikes on the weekends. Then one morning I woke up, it was a Monday morning, I woke up, my heart rate was near 200. We went to see my HCM clinic. The nurses took my EKG and they just flipped out. Fortunately, the arrhythmia broke right before the doctor was about to put the paddles on me. And I was taken about 100 yards right next door to the hospital. They kept me for a couple of days while they tried to figure out what to do with me. At one point, I had nothing but water to eat or drink for about 40 hours. They finally sent me home with a new prescription for antiarrhythmia drugs, one of those portable defibrillator vests, and an ablation scheduled for the next month. Arrhythmia is unpredictable, overwhelming, and terrifying. There is no silver lining. It creeps up on you a few skipped beats at a time here and there. It sneaks in while you're asleep to assault your senses when you wake up. Or sometimes it just falls on you like a pile of bricks when you're having an otherwise fine day. It can smother you, especially your nerves, as you can think of nothing else except how fast your heart is pounding. Is it slowing down gradually? Is it quickening? How long has it been now? 20 minutes or 20 hours? Is this how my grandfather died back before HCM was discovered? How many vaguely worded coronary failure deaths on the family tree does this explain? It does a real number on your state of mind, and it's intricately wrapped up with a creepy anxiety that clenches its tentacles around you while you're sitting there just willing your heart to slow down. I had 4 ablations in the span of 2.5 years. Living with arrhythmias is a long game fraught with uncertainty. One of the ablations effectively stopped my AFib, but then atrial tachycardia cropped up. It's a delicate balance of medication, controlled exercise, and the worst and most difficult part, just managing stress. I gave up drinking before I had surgery, and I've given up coffee in the last year. I walk about 3 miles each morning. In the 1.5 years since my last ablation, I've lost a lot of the weight I've put on over the past few years, and I feel the healthiest I've been in a while. But I haven't won. There's no winning when you're equipped with an HCM heart. There are incremental things that can feel like small victories. Breaking even in the long run is considered a feat. It's always there, just lurking beneath the surface and ready to pounce when you begin to let your guard down. If you get a few nights of bad sleep in a row, if you have that glass of iced tea with lunch, if you don't hydrate enough in the heat. Any of those things and a million other tiny things can send your heart into triple time. The electronic pulses defying every ounce of control that your mind and body try to deploy. When you're in it, it's all you think about. And when it breaks, all you think about is the fear of it returning again. If I could give one message to younger people getting diagnosed with this condition, especially those who are asymptomatic, take it seriously. Do yourself a huge favor. Ask your doctor about mental health. Get a referral and speak to someone about it. You're getting a pretty ominous card dealt to you out of nowhere, and nobody's equipped to handle something like this on their own. I didn't start seeing a therapist till I was way into my arrhythmia. I had one failed ablation behind me and another postponed one ahead of me. It's worth it, even just to blow off your frustrations at the whole thing. HCM is a life-changing and often life-threatening diagnosis. It should go hand in hand with a healthier mind and body, and your cardiologist should be supportive and open with any questions you have about anything. Stress and heart conditions are a nasty combination. If the last few months have taught us anything, it's the importance of willingly accepting a new normal in our lives. Most of us with HCM have been constantly doing this for years, reshaping our routines and lifestyles as needed as new medications or conditions crop up. There are highs and there are lows. The trick is to get all the enjoyment you can out of living in the middle. The rest of it's going to pan out no matter what. It's up to us to be ready for it.
My name is Priscilla Williams. I'm originally from Greenport, New York. I am married and currently living in Flanders, New York. At the beginning of my career, I was a secretary assistant for a Plum Island animal disease laboratory. I also attended school to become a nurse's assistant. I trained in the hospital and local nursing home where I received top grade, but it wasn't what I was called to do. I am a retired preschool teacher's assistant. I also taught as a UPK teacher. I have HCM and I have had genetic testing, which came back negative. The doctor still instructed me to have my children request their doctors to test them. I contacted my children and explained what I knew about HCM and how it is a genetic disease and it is important for them to be tested. My son Terrence and daughter Melissa stated they had their doctors test them and that they didn't have HCM. I was elated that they were supposedly okay. For me, taking a shower, flight of stairs, and walking from my car to a building was a challenge. I would have palpitation, dizziness, chest pains, and I felt tired all the time. Despite how I felt, I continued to perform my daily tasks, to keep my household operating and to hold down a job. I just wasn't going to let this condition stop me from doing what I needed and wanted to do. I had a family emergency, which involved a lot of traveling. I took 2 flights, from Oklahoma to Virginia, then from Virginia to New York. I went back to Virginia by car, and then I returned home to New York. Upon arriving home, I helped call my husband, who has Parkinson's disease, into the house and unloaded the car. Once I started retrieving the messages from my phone, I hit the floor. I fainted. I never felt doing those tasks was too much for my heart. I was wrong. My chest pain started to become severe, so awful that I was very much concerned. I didn't understand the seriousness of HCM until my chest pains became unbearable. A couple of steps from my car onto a building would bring on the worst attack. It would feel like someone was throwing bricks into my chest, and I couldn't catch my breath. Once I got where I needed to be, I would stop and try to get my breathing under control, and luckily I always did. I did fear that maybe one day I would not be able to. Even though my daughter Melissa was born with a heart murmur and had a cardiac catheterization at the age of 2, I was told she would outgrow it and that there was nothing to worry about. Both of my children lived in Oklahoma State. Melissa's marriage was having problems, so she moved in with her brother and his family until getting her own space. In August of 2017, my daughter Melissa was found dead on her kitchen floor by her roommate. She was only 37, and she had only lived in the apartment for 2 days. The apartment was located on the 2nd floor, and listed on the death certificate for cause of death was HCM. Melissa always had me concerned about her health because it was in a poor state of condition. She was always in and out of the hospital, but HCM was never detected. I don't feel there are words for how overwhelmed with grief and sadness I was to learn that HCM was undetected throughout Melissa's health care. I took the certificate to my doctor, and he also couldn't believe that it was missed in her health care. He immediately composed a letter requesting family members to be tested. My siblings, all but one, has been tested. After having alcohol septoablation, my condition has improved. I do feel a lot better. I am able to walk a distance, cut my grass, climb a ladder to wash windows, and much more without having to stop so often. I am currently enrolled in Yale University Clinical Study for Lifestyle and Exercise in HCM. Thank you for listening to my story. I do appreciate the time to share my experience, what I'm going through.
My name is Linda Newhausen. I'm 54 and I live in Spring Hill, Florida. When I was 39 years old, my family and I were heading to our nosebleed seats at a baseball stadium in Tampa. When we reached our seats, my heart was beating so hard, it felt as if it was jumping out of my chest. I was gasping for breath. My left arm had gone numb and my face had turned a disturbingly ghostly shade of gray. I frantically looked around at my family and thought, I'm having a heart attack. At the time of the first heart event, I was married with 3 young children, and in the fall semester of my last year of law school. It was a new beginning for me of a second career after spending almost 20 years in retail management. During the next 6 years, my health deteriorated quickly as I had tried to launch my new career. I graduated, passed the bar, and started my first job as an attorney, but I couldn't keep up the pace as symptoms of chest pain, dizziness, shortness of breath, and fatigue increased. I would sleep in my car during lunch hours to get through the day and would pass out on the couch when I got home. When the weekends came, it became impossible to enjoy the activities that my kids loved to do as a family. I could no longer hike, take a bike ride, or enjoy our family adventures of exploring new places. I would even fall asleep watching movies with them. I saw many doctors and had many tests, and I was told nothing was wrong with my heart or with anything else. I thought I was crazy. My husband did too. I had to quit my job and take a less secure position that offered flexibility and allowed me to work more from home. Finally, after 6 frustrating years, I was diagnosed with hypertrophic cardiomyopathy. I was alone at a clinic, 3 hours from home, and the doctor explained the news to me. I had no knowledge of the disease at the time or what it meant for my future. When I called my husband and told him, I was half scared out of my mind that I had this incurable heart disease and half relieved that I wasn't crazy. I was already so ill at the time of diagnosis, the treatment options progressed quickly. Medication management was aggressive, but proved ineffective as my heart failure symptoms were quite severe. I had myectomy surgery 6 months after diagnosis, and my life stopped in its tracks that day. I was still sending emails on the law cases I was working on as we were heading to the hospital in another state, and I had no idea that the life I knew then would never resume. The surgery only provided minimal relief, and my symptoms continued to plague me despite cardiac rehab and different medications. I was unable to return to work, and my life unraveled personally, financially, and emotionally. My husband did not understand why the surgery did not provide symptom relief and restore my quality of life so that I could return to work and to a normal life. This only added to the frustration that I was already feeling. After doctors found that I still had significant obstruction and other complications, I had a second myectomy surgery 6 months after the first one, and after a difficult recovery, my symptoms persisted. They continue to severely impact my quality of life today. I have chest pain and shortness of breath with just the slightest bit of exertion, a few steps up the stairs, hurrying a bit to get across the street, or taking a shower brings it on. I have exercise intolerance even though I work at it every day. Simple household chores like folding clothes or doing dishes take everything out of me. My fatigue is severe. It is hard to focus much of the time. None of this is helped by the high dose of beta blockers I am on to keep my heart rate low enough and the other medications I take to manage my symptoms. I was never able to return to work, and I made the difficult decision to file for disability. I keep my law license active with the hope that I can eventually return to some meaningful level of work in the future. My husband asked for a divorce shortly after my second open heart surgery and left the state a year later. I raised my 3 teenagers by myself as a single mom. I learned ways to manage my symptoms and be there for my kids. I would sleep most days while they were at school, carving out small parts of the days to get the important things done and be able to participate as best as possible in my kids' lives. I made sure I never missed their special moments, whether I had to rent a golf cart to follow my son's golf match or let them do the driving when we checked out colleges. I found joy in watching my children thrive, and I used therapy, medication, and meditation to deal with anxiety and bouts of depression. The disease has definitely changed the way I do life. I was high-performing and loved competition and challenges, so it has been a difficult learning curve to adapt to this new lifestyle. I have learned to appreciate the small victories and beauty in life. But my heart and HCM are always on my mind. I worry that it will shorten my life unnecessarily, and I constantly look for ways to make sure that whatever life I have left is not being wasted. Although my life has changed drastically since my diagnosis, it hasn't changed the core person in me that rises to a challenge.
My name is Derek Wormley, first of all. I am 54 years old, and on October 30th, 2015, I was on my way to a meeting at the police department. I'm a police officer, police detective, and as I walked through the roll call room, I just dropped, collapsed, and I was not breathing, no pulse, no nothing. And my coworkers, 30 of them were in there, and they immediately, I should say, started CPR on me. They continued to do CPR on me, and they knew that there was something wrong and they couldn't revive me. So they already called for EMS to come. They arrived on scene, the first responders arrived on scene, and they determined that I needed to be shocked back to life, and they didn't have a defibrillator. So they took over CPR, and they called for one. And just by the grace of God, there was a EMS worker on his day off. On the way, he was a block away from the police department, and he had his own AED. He paid out of his pocket, and he had a scanner on, so he was able to get it to the police department. They shocked me several times and revived me, and they immediately got me out to the hospital, where I was life flighted to Duke University Hospital. From there, I was placed in a medically induced coma, and for 4 days after they eased me out of the coma, I awakened. I was in a real state of confusion. I looked around, I looked to my right, and my wife was by my side, and she told me that they believed that I had a heart attack. So from there, my kidneys failed on me as well, so they really couldn't do much with me at that point. But once they went in to do the check to see if I had any blockages, I had none, zero, nada. So they were trying to figure out what caused my sudden cardiac arrest. So I had waited about 3 weeks before my kidneys were able to function back, where they could do the test. And once they went in, they found and they diagnosed me with hypertrophic cardiomyopathy. Once I got the diagnosis, I was really confused because I didn't know what HCM was. They basically told me that I had an enlarged heart, and my lower left ventricle, the walls were really abnormally thick, and I had to do a lot of research on that. And I was really scared because they told me that because I went into ventricular fibrillation, that it can happen again. So they implanted a ICD pacemaker. I was just overwhelmed because, not knowing what I had this all along. It was just a whole lot to process. And they told me there was no cure for it, and I have to take the atorvastatin and carvedilol for life. And they told me that, my lifestyle would have to change. There's a lot of things that I would not be able to do. And, that right there just really struck me really hard because I'm a guy that was active, police detective. I participated in sports activities and all that. My grandchildren, playing with them, and just not be able to do that anymore, full speed like I used to. That was really devastating to me. It really was. When I went in after I got my defibrillator implant, the doctor asked me, he said, I understand you're a police officer, right? I said, yes, sir. He said, is there any other job you could do? From right there, I knew my career was over. But he also asked me about my family history. I told him that my father had died of heart failure. He asked me how old my father was. I said 58 years old. He said, well, did they ever give him a diagnosis? No, I just told him they just said heart failure. He never had got tested for that. And he recommended that I do genetic testing with my siblings. And I have 6 children and I have 5 grandchildren. So, I talked to my family members, told them, my siblings and my children to get the genetic testing. It pretty much fell on deaf ears. I stayed on them, constantly, and just kind of, I'm gonna do it. And they never done it. Well, January of this 2020, I lost my brother to sudden cardiac arrest. And I was there to see him take his last breath. And all I could think about is I kept telling him to get himself tested, and he just kept putting it aside. And I just, we can't twist the arm of our family members. They have to want to go to get it done. And I'm constantly on I have a brother and sister left now, and my children, I'm constantly on them. They have yet to do it, but And my brother, like I said, was 52 years old. I had my sudden cardiac arrest at 49 years old. So my father, my brother, and me, we were all under the age of 60. And I'm still pushing my family members to get tested. You know, I want a cure for HCM, but I don't want to have to take medications for the rest of my life. I don't want to have this device, but I know it's there. I wish there was a drug that we could take to help, you know, cure me and cure all people like me. I would like to take time to thank the FDA for listening to me and listening to my story, and everybody that's involved that's working so hard to try to make a drug to help cure this disease. And I just thank y'all all for this and giving me time to talk to y'all. Thank you.
Wow. Thank you. I just want to, that was incredible and incredibly brave of Linda, Rush, Priscilla, Cole, and Derek all to, work to, kind of really share their own personal experiences and be brave enough to put that into a recording for us to share today. So really appreciative of that. And we hope that all of you that are tuned in live will similarly call us and write us to share your experiences as well. So as I mentioned, now we're going to get to the part of the program still focusing on living with HCM and the symptoms and daily impact to try to understand other experiences that you have. And it's okay if that is still something similar, but you have your own personal experience with it, or if it's something that is additional, different than what you heard from those panelists. So we'd like to start with a couple of our first discussion questions, where we want to hear from you of all the symptoms that you have living with your HCM. Which 1 to 3 symptoms have had the most significant impact on your life? And we still want to get a sense of, how those symptoms affect you kind of day to day, what those look like, maybe your best day to your worst day. As a reminder, if you have thoughts on this, we'd like you to call in. The phone number for that is 1-703-844-3231. Again, that number that you can dial is 1-703-844-3231. Go ahead and call in and we'll be able to talk with you live. The other option is you can also provide some written comments that you can submit to that form that is below the live stream that you're viewing right now on the website. To get us started, I want to first go to a pair of polling questions that we have for you. So go ahead and pull out that device, that cell phone, tablet, or if you're following along on your computer and you want to use that, you can open that tab. For those of you that may have joined that weren't part of the first session, you can see that URL right at the top of the page here, pollev.com/HCM. Go ahead and type that in. That'll take you to the live polling questions, and you'll be able to follow along throughout the rest of the session. So for our first question on this topic, we'd like to know which of the following HCM-related health effects do you experience? And here we want to get a sense of all that apply. So let us know all of the different health effects that you have as a result of your HCM. Your options here are A, advanced heart failure, B, chest pain or pressure, C, shortness of breath, D, heart murmur, E, lightheadedness, dizziness, or fainting, F, arrhythmias and palpitations, G, sudden cardiac arrest, H, fluid retention, I, exercise intolerance, J, weight loss or gain, or K, some other HCM-related health effect or symptom that you have that is not listed on this slide. So again, please select all that apply.
No surprises here either. Seems like a day on the phones at the HCMA.
All right, so we'll give you a few more moments to get your responses in here. As it stands, it looks like, and I should point out that because this is a question where you can respond with more than one response. The percentages you are seeing are not the percentages of our respondents that have any one of these particular health-related effects. These are the percentages of total responses that we're receiving. So what you can do is kind of view the ranking of these. The greatest experienced HCM-related health effect is shortness of breath. Followed behind that, I would say we have a clustering of things. We have the lightheadedness, dizziness, and fainting, and exercise intolerance, as well as heart murmur and arrhythmia and palpitations, and even chest pain or pressure. Kind of after that, you're seeing other more common health effects being weight loss or gain and fluid retention. However, we do have respondents that have experienced even advanced heart failure and sudden cardiac arrest. I point out that there's also a number of people who have reported other, and we'd be very interested to have you call in and write in to let us know what those other health effects are. If we go to a second polling question, it'll be the only other polling question we'll do right now. So we want to know of those same HCM-related health effects. Here we want you to select the top 3 that are most burdensome to you. So of the HCM-related health effects that you've experienced, which are the top 3 most burdensome? So you can select up to 3 options here. So the same options are A, advanced heart failure, B, chest pain or pressure, C, shortness of breath, D, heart murmur, E, lightheadedness, dizziness, and fainting, F, arrhythmias and palpitations, G, sudden cardiac arrest, H, fluid retention, I, exercise intolerance, J, weight loss or gain, or K, if some other HCM-related health effect is one of the top 3 most burdensome that you've experienced. So we'll let you think about this a little bit, get in your responses in terms of which are the 3 that are most burdensome for you. All right, as it stands, it looks like the greatest, most burdensome HCM health-related effect or symptom is shortness of breath. Followed by lightheadedness, dizziness, and fainting, arrhythmias and palpitations, and exercise intolerance. Maybe third kind of in the ranking is the chest pain or pressure that patients experience. However, every single symptom and health effect that we have listed has been selected by some number of individuals as a top 3 most burdensome aspect. So now I'm going to take this to our audience to add to the conversation. And one thing that we have today is actually some invited patients and caregivers who are serving as our Zoom panelists. So if we can go to our Zoom panel here, I would like to actually invite Gordon, if you would mind. Here we're talking about the most burdensome symptoms and the impact that they've had on your life. So I was wondering if you might share for us, as you were answering that polling question, what you thought.
Well, for me at present, the most burdensome are lightheadedness and arrhythmias. In the past, I've also had severe problems with fainting. Well, that's I think that answers that. I should add that I helped to moderate a discussion board of about 7,000 HCM patients, and I've been doing it for about a dozen years. And on that board, I think, well, all of those complaints do come up frequently, but I think very frequently people complain about exercise intolerance and lightheadedness and fainting. I think it was last week, somebody made the comment that they were exhausted after changing the sheets on a bed, which is certainly more severe exercise intolerance than I experienced, but it's not the first time I've heard things like that.
Sure, and just to get a sense of, that particular person that had written into the discussion board versus, you mentioned that you don't have as much exercise intolerance. What does exercise intolerance look like for you? For me,
feel it, especially when I'm either at elevation or, and this is very common also among people on the board, doing things like climbing gradients, going up steps, riding a bike up a hill, things like that. They can be exceptionally difficult. And I am almost always the last person in the group to achieve that.
Sure. Thank you so much, Gordon. We'll be coming to our Zoom panel throughout this session to provide some inputs. But I'd actually like to go to one of our phone callers. Ben from Virginia wrote in or called in and wants to talk about some of his experiences with HCM. Ben, are you with us?
Last year, when I was a sophomore in high school, I had my first sudden cardiac arrest in school. I wasn't doing any sports when it was happening. All I was doing was walking up my steps to my first period chemistry class. I was extremely fortunate to have survived this crazy event. I didn't have any symptoms that led me, my family, or my doctors to think that I had a deadly disorder. But I do have hypertrophic cardiomyopathy. And it has almost killed me not once, but twice in less than a year. Looking at me, no one would know that I have a bad heart. I appear to be able to do the things most other people can, but HCM has changed my life. I can no longer participate in things that I used to enjoy. The doctors told me not to go into open waters, so I can't go swimming in lakes, rivers, or oceans anymore. I can't participate in competitive sports. I also feel isolated from friends when I can't partake in the fun things that teens like to do, such as going to an amusement park and riding on the roller coasters. My mom is fearful of letting me drive a car since I might have another blackout while driving and cause a crash. My doctors tell me not to travel to remote places without access to medical care, so I can't travel very many places in the world. My college decision will somewhat depend on where I can have good medical accessibility. I am anxious about the burden that I might place on my future wife. I was wondering about if I should have kids, and will this disease have a larger impact that will cause me to have a heart transplant in the future?
Sure.
And that was amazing. How old are you?
I am 17 now.
Yeah, Ben, that you covered a lot of ground in that, in sharing your experiences and also your worries, which is, really what we're, all of that is what we're looking to try to understand here. Now, I was wondering when you were talking about, some of those different activities that you're unable to do, which specific symptoms that you have makes it so that you can't, it's kind of you're contraindicated from participating in those different activities that, you would have liked to be able to?
I would say shortness of breath. Like I heard in some of the other people talking,
Sure.
that they have a hard time when walking a short distance and they run out of breath. So when I try to do sports such as soccer or basketball, I don't have enough, I just run out of breath, and it's really hard to keep on going because I have chest pain.
Sure. And is that something that is do you have, is that pretty much the same for you most days? Are you, able to, kind of do the same amount of activity, or do you have, kind of better or worse days?
I would say usually they're about the same.
Okay.
They're not very varying. Yeah.
Okay. No, that's extremely helpful, Ben. Thank you so much for calling in. So
thank you for having me.
You're very welcome. So now we actually have another phone caller who would like to share some of their family's experiences with living with HCM, and that is Tim from Nova Scotia. Tim, are you with us?
Hello, I'm here.
Hi, Tim. Welcome. I'd love to hear about you and your family's experiences.
My family's history of HCM started when I was 6 weeks old. My mother went for her post-delivery doctor's appointment and came out to the family car and picked me up and told my father that everything was fine, and she dropped dead. So it started pretty early with me. Since then, we have lost my brother, 2 nephews. 4 of my 5 brothers have HCM. We all have 2 mutated genes that are known of. We have 9 children. 3 of them died. 6 of them have ICDs, and the burden that you have to live with this disease, when especially, other than every other symptom that's treated with drugs, that they well, this might work and this might work because it works on other parts of the heart. So that's a burden because you're always just trying to do something that way. But the biggest burden for us with sudden cardiac death is how do you live a normal life knowing that a huge percentage of your relatives aren't here because they just died suddenly. So when you can't get in touch with them, or they can't get in touch with you, or they're going on a trip, or they're planning on having children of their own, it's a huge cross we all have to try to carry and try to live a normal life with.
Sure. I can't even imagine both, trying to live with, the symptoms and, the day-to-day burden on top of that great of a stress on your entire family. So thank you so much, Tim, for
Tim.
joining us.
Okay.
So
I have some written comments I'd like to get
perfect.
to as well. And we do appreciate your written comments as well. And I want to make sure that everybody understands that all written comments will be included in our Voice of the Patient report as well. So I have a couple comments here about symptoms, specifically Linda's commenting about her symptoms of tightness in the chest. And chest pain is a very hard term for people with HCM to understand because it's not always pain. It's a tightness. It's an elephant sitting on your chest. There's lots of different words patients use to explain it. Linda chooses to use chest tightness as her explanation of chest discomfort. We have a couple of other people who are, saying very similar things, but I did want to read a portion of Julia's comment. Some of you have written some very eloquent statements, and we thank you for that. We're going to kind of break them into pieces here today. And she's mentioning that her pulse lowers and her blood pressure lowers inappropriately with HCM, and this causes her a little bit of anxiety and to feel poorly and have to stop what she's doing, and it gets to you. She also tries to not be bedbound, but it appears that she's bedbound more than she wishes she was, and that emotionally it is quite draining on somebody when you can't get up and participate in life. So we have this very complex maze of symptoms that are related to HCM, from an occasional chest tightness to walking up a flight of stairs or a slight incline. I bet you any person you know with HCM can find the hill in a flat desert. We can find it and we can tell you what grade it is. So we're very, very susceptible to those little gradations and a flight of stairs, and we're getting lots of comments on that. We just got a couple in regarding the effects of HCM causing anxiety. And then you're trying to manage your anxiety, oftentimes with medications, and some of those medications can be contraindicated to those with underlying cardiac conditions. So you're trying to manage 2 things at once, but the anxiety is normally provoked by the HCM, not the other way around.
Wow.
It's complicated.
Yeah. Thank you, Lisa. And we want to keep encouraging you to call in, write in. We're going to try to get it to as many of you as possible throughout the session today. Just as a reminder, if you want to call in, that number, just one more time for you, is 1-703-844-3231. So we've been hearing, just Lisa was able to capture some unique symptoms and including things like anxiety that patients experience. I want to go to our Zoom panel now and ask Gwen if she can share with us some of the symptoms and maybe any unique experiences that she might have had with those symptoms to kind of help round out this discussion a little bit.
Sure. Thank you, James. Listening to everyone who's spoken, it really just brings back so many memories for me. Diagnosed as a young woman, actually shortly after I'd moved to Washington, D.C. to work for the Department of Health and Human Services. But my symptoms dated back even to when I was in grade school. I attempted to do a 600 run walk of the President's Physical Fitness Certificate when I was in grade school, and I couldn't complete it, even just walking. And for many, many years, the symptoms were very vague as a young woman. When I was finally diagnosed, I think the symptom that has been most pronounced for me as a younger woman was ventricular palpitations. I described it often. It feels like a horse kicking the inside of my chest. I've had incidences on the metro in Washington, D.C., where I've literally been laying on the floor, taken to hospitals, been told I had a heart attack, spent the night in park benches or on park benches, discharged from hospitals, misdiagnosed. But the underlying symptom that I recall most now, many, many decades later, was this incessant sort of out of nowhere pounding in my chest. And I think one of the things to help people understand what it's like living with HCM is because you have a thickened wall muscle in your ventricle or in your heart, regardless of where it is, that no matter what symptom you have, whether it's AFib, ventricular tachycardia, premature atrial contractions, no matter what it is, the dynamic force of it is so great that you're consciously aware of it. And so while some people can live asymptomatically in AFib, for example, I cannot. And fast forward to more recently, just during the pandemic, flipping in and out of atrial fibrillation, being in the hospital 9 days out of 2 weeks, not able to control it. Every heartbeat a patient with HCM can detect. And it's that sort of overarching fear of never being able to get away from it that I think you've heard other patients describe very eloquently.
Yeah, no, Gwen, that's very insightful. I'm just curious. You talked about you described it kind of like the horse kicking in your chest, or this really powerful heartbeat. When you were kind of experiencing those symptoms, well, I guess one is, how often would that occur, and did that change? You said that was one of the earlier symptoms, but that's, it sounded also like that's continued over time. So kind of how often would you experience that? And then when you did, what did that, do to you that day or, that period of time while you were experiencing that symptom?
Well, definitely for me, my symptoms, my palpitations, irregular heartbeats, and I'm a textbook. I mean, every kind of dysrhythmia I've had. So pick one, I've had it, PVCs, PACs, all of them. I think what the word that's coming to my mind is the uncertainty. Uncertainty and the fear of not knowing creates so much anxiety and stress that you get the double whammy of the adrenaline and the nervousness, which everyone knows exacerbates your heart rate to start with. So it's a lot like living with life with one foot on the brake and one foot on the accelerator. You're trying to move ahead, as I was, either to get through graduate school, take a new job, move to a different part of the country, and you're trying to live a quote unquote normal life. And invariably, too many times to go through right now, something would happen. And I had just moved to Washington, for example, in 1988 to start a new job as a consultant to the federal government. My life ahead of me, graduate school, and was doing nothing more than riding the metro to meet someone in DuPont Circle when this, I consider it probably one of the worst days of my life, put me on the floor of a metro. Situations like that set you back. You end up having to go back and get additional tests. You are utterly emotionally devastated. You're scared. You don't know who to tell. The first thing that I was told by a cardiologist the next week is that I would have a shortened life expectancy, the very first thing out of his mouth. And I was barely 28 years old. And I've never forgotten that. And that is sort of like going through life, wondering when the next fainting spell is going to occur.
Wow.
Just yesterday, I'm on a new medication. I got up from sitting most of the morning to sign off on a UPS package. And in the 8 seconds it took me from walking to my chair to the front door, and the UPS driver hands me the pen, I'm looking at him and I have no idea what to do. The brain fog just hit. And for like 10 seconds, I'm standing there thinking, I know who this person is, or I think I know what I'm supposed to do, but I don't know what to do. And that happened just a few days ago.
Wow.
So it's something that you, as an HCM patient, will always live with.
Sure. Thank you.
There have been years that I've done perfectly well, but when it does hit, it hits you not only physically, but emotionally.
Gwen, those are very common experiences in HCM, but you eloquently put them together. So I think almost anybody with or without HCM can understand what it feels like.
Yeah, I think 1 foot on the brake, 1 foot on the accelerator, that kind of really stood out, pungent to me. I know we're trying to kind of cover different symptoms, and one thing that I've learned from you and the community so far is that fatigue can actually be, quite a disabling aspect of the disease. Do we have any written comments
We
that you
have a
can
couple
share?
of written comments on fatigue that I'm happy to share with you. Happy and unhappy in the same sense. Fatigue is one of those things that is poorly understood in HCM as to what the mechanism actually is, but it's something that a lot of patients experience. And we have a comment from Sarah from Greenbrook, New Jersey, Jersey girl here. And she talks about having side effects of fatigue, dizziness, weight gain, and issues with controlling body temperature. There's some issues with heat intolerance and cold intolerance with HCM. And oddly, they do seem to connect with fatigue. Once you get overheated, you get fatigued very quickly and you're done for the day. It's what I used to call a couch day. You're done. And Yvonne from Baton Rouge, Louisiana is talking about having trouble catching your breath when you're having conversation. And when you have the trouble catching your breath during a conversation mixed with the brain fog that Gwen was talking about, you can get disoriented very easily. And you could be in the middle of a business meeting or at a store trying to explain something to a clerk, and you're trying to talk and you're getting confused. And these are real things that happen every day, and they happen to patients all over the world with HCM. I think what's really critical to try to delineate is who has fatigue related to side effects from medication and who has fatigue related to their underlying HCM and some possible abnormalities with circulation of oxygenated blood to the body. So we have to look at two reasons why it might happen, but when you're a patient with HCM and it happens, the mechanism is less important as the actual symptom itself. So I think it's really important to understand that a lot of patients with HCM experience fatigue. I'm going to look here through some other notes. I think Juanita mentions it as well, and Daniel in New Mexico, he can't even tolerate hot weather to go to his mailbox. He needs a wheelchair. And he can get very, very dizzy from that as well. Sure. So this whole neurologic aspect of you're up, you're fine, you're now out of breath, you're tired very quickly sometimes, and you're confused. And it can lead to some very frightening moments in the life of somebody with HCM.
Wow. Thank you, Lisa. So I want to kind of move on to another discussion question that we have, which has already started to come up, which is that these symptoms and health effects, aren't just, they're kind of burdensome in themselves, but they also, the reasons that people rate them as being most burdensome have to do with the impacts that they have on their lives. And so I'd like to go to our third polling question. So this is your chance again to pull out your phone, go to that other tab, and we have a polling question for you to try to understand the impact that living with HCM has on different activities in your life. And so here we'd like for you to select the top 3 activities that are most important to you that you are not able to participate in at all or to the degree that you would like due to your HCM. So your options here are A, walking, B, exercising, C, participating in sports, D, social interaction and participation, E, attending school, F, being sexually active, G, performing your job, H, traveling outside your home area, or I, some other activity that is important to you that you're not able to do either at all or as much as you would like due to your HCM. Please select the top 3. We'll give you some time to think about this, get in your responses. As it stands, it looks like a top one that's, again, these are percentages of responses, is exercising. That seems to be one of the top most important activities that you are limited in doing, either altogether or to some degree. Results are still coming in, but it looks like, other activities that are most limited, that are most important to you, are being able to participate in sports, being able to walk, and being able to participate socially in social interaction and other social activities. Results are still coming in, but we also see a fair number of people reporting that even traveling outside your home area is a big impact, so impact on travel, and impacting on performing your job, and then even being sexually active. We have a few people reporting that it has had an impact. One of the top impacts is being able to attend school. And then we have, a fair number of people also saying other. So again, we really want to encourage you, if we've got something that, is important to you, to help, and it's not listed here, to call in, write in on that little comment box under your live stream to help us understand that. But certainly it looks like, the physical related activities tend to be the ones that are most impacted, but there is a large impact on other activities. We have actually a couple of callers that have some, want to share some of their impacts on, lifestyle and life activities. So I'd first like to go to Gretchen, who is calling in from New Jersey to talk about her experience with the impact on her and her family. Gretchen, are you with us?
I am. My issues were kind of the earlier call, which is the horror of sudden cardiac arrest and the effect it has on families.
Sure.
My son passed away from sudden cardiac arrest in October, and God bless Ben, the earlier caller, because he's alive. Because when these events happen, they shatter families. We're devastated. My son Matthew had a twin brother named Michael, and Michael he's just devastated. It's going to be hard for him the rest of his life, knowing that his brother is not there with him. Matt's death was a huge loss to our community. Matthew was a fireman. He participated in our church. He was involved in the town management, and he was also his death was a loss to our country, because he was at the University of Chicago. He was a brilliant math student, and he could have done chairman of the Fed. He could have been a large contributor to our society, our community, our government, and now he's just gone.
I have to comment.
He had it
Gretchen,
all.
Gretchen, thank you for calling in. He was also an intern at the HCMA office a few summers ago. So his death is devastating for the entire HCM community, as well as your family, and there's just no words sometimes to express what these deaths can do to a family. And they come unexpectedly, and they're the ones you least expect them to happen to.
Sure.
Sometimes.
Yeah. Thank you so much, Gretchen.
Thank you, Gretchen.
So I'd like to also, on this topic of impacts on activities and the life of individuals, go to Amanda from Maryland, who would like to talk about the impacts on younger patients and their lifestyle. So Amanda, are you with us?
Hi there. Yeah. So I specifically wanted to talk about living with an ICD for younger people. So I was first really diagnosed when I had my cardiac arrest at age 13. Mine is a genetic thing, so my mom also has hypertrophic cardiomyopathy. But for me, my ICD has been really helpful in my life because I've already had to use it once. I was walking down the hallway at school, and it went off because my heart rate was in the 200s. So being shocked by that was, well, shocking to say the least, but it's been a really important part of my life because it allows me to still do things that I wouldn't normally be able to do if I was just on my own without a support system. But at the same time, I have a sense of complacency because as a young person, I'm 16 now, I don't have very many other treatment options. I take calcium channel blockers, but I'm not a candidate for a myectomy, and all the other therapies that are options for other people aren't for me. So sometimes I wonder, am I just going to walk through life every 10 years getting a new ICD and waiting for something else to happen? And a lot of the times I do worry about that, but I'm still grateful that I can do things like exercise and engage in some sports, although not competitively and not intensely. But I have to live with that concern as well of just wondering, is this my life for, however long I end up living? So it's a bit of a toss sometimes.
Sure. And when you were, you talked about, the ICD has allowed you to continue doing some certain activities. Can you tell us a little bit before you got that first, your ICD, what was going on in your life? Were you noticing that, you had a difficulty, being able to participate in, sports and activities with, friends and peers your age? What stood out to you in that period of time in your life?
Yeah, before I got my ICD, before I even had my cardiac arrest, I was doing intense competitive soccer, swimming, running, hanging out with friends, not really worrying about, my physical health in any regard. As a young person normally doesn't have to worry about that. But after this, I can't really play sports in high school. I tried doing cross country, but it was too intense, so I had to quit. So, now I'm really limited in that sense. I, go jogging on my own sometimes, but it's very slow. I wouldn't really consider it jogging. So, yeah, for the most part, I try and stay as athletic and as healthy as possible. But compared to the normal person, I'm not on the swim team or, on any high school sports or anything like that. So as a young person, it does feel a little bit of a disconnect for me because, I want to live life to the fullest, but at the same time, I have to kind of walk around and act as if, I could have an emergency at any moment sometimes. So it can be a bit difficult, but for the most part, I think I manage.
Wow. Well, thank you so much.
Thank you, Amanda.
It's a lot to manage, not to understate what it is that you're living with. So I'd like to, go to our Zoom panel for just a moment and ask on this topic of, activities that are important but that you can't do or do as fully, and see if Ashley, you could share with us what those look like in your life.
Sure. What comes to mind immediately, since we're in the summer, is being active with my children. I have two children who are ages 7 and 12. Before, this COVID pandemic that we're experiencing, we would have spent the summer, would have spent the summer going to the pool, swimming in the pool, and being active outdoors. I actually I got a waiver from our pool so that I could have our babysitter go in my place. The membership covers me and my husband and the kids. And I said, I will never go to that pool because it's too hot for me to be in the sun. I get short of breath. It's not a good, it's not a fun experience for us as a family for me to just sit there and watch the kids. Of course, it's fun for me to watch them, but it's, it's heartbreaking for me not to be able to get in there with them. And they're old enough now that they understand why I can't interact with them in the pool or in outdoor activities. But, it's hard. It's hard for them. We've gotten used to it as a family, but it's, in each activity, we have to kind of consider carefully how we're going to proceed with it. We're not going to go on a 2-mile hike in a, with an incline or a gradient, like Gordon mentioned earlier. We could walk around, a very flat surface. So we have to do a lot of planning to be able to participate in activities together outside the home that involve any kind of activity, any kind of exercise.
So kind of in addition to modifying who actually goes with your children to the pool, right, and the planning, what kinds of activities are you able to kind of plan for and, maybe now do, kind of given this, your situation?
Yeah, so, we certainly remain active. We go on walks. They're just carefully planned. We know now what our route is, so it's not like every time we go out, we have to, plan it, but we know we can walk certain parts of the neighborhood that are flatter than others. And, we have a very energetic, happy little dog that we take out, and he goes and fetches the ball. So we toss the ball for him and he gets it. So, I mean, they're little activities, but they're, fun nonetheless, and they're bonding experiences for us. So we enjoy each other that way and remain active by doing, dog walking. And, I'll go to sporting events for my son. My daughter does archery. She has HCM. And so we are very careful to limit her activities and her exercise. She's careful in her gym class, and she's taken up archery, which is a safe sport for her at this point. So, that's how we manage it and how it sort of affects us day to day.
Wow. Well, thank you for sharing that, Ashley. Before we go to another phone call, I want to check in with Lisa to see if we have any written comments coming in about impacts on activities.
We have a comment from Julia from Canada that she loves to hike and dance, but she's not able to do it to the degree that she would like to do. And she would like to be able to be out with her friends more often, but the fatigue and the symptoms related to HCM often have her doing something very typical to the HCM community, and that's declining social invitations because they either feel like, one, they're just too tired, or they're fatigued, or they're just not having a good HCM day, and they don't want to deal with having to go out like that. Or, much more commonly, they're afraid that they're going to get there and be at the event and then not be able to fully participate. They're not going to get on the dance floor because they're tired, or they're overheated, or they're dehydrated, and they're having symptoms, and thereby they're sitting on the side and they're watching their friends have fun and feeling a bit left out. So there's a real issue with that psychosocial connection, and it's really frustrating for patients with HCM when these symptoms come up out of nowhere. And what Ashley was just talking about, this heat issue, a day at the beach. Think about how hard it is to lug all your stuff out to the beach. Now, if you have HCM and you get there, and that's about as far as you can go, getting back to the car is always a challenge. So all of these functions of daily life that so many people take for granted are just things that we have to plot, plan for, and really make up new rules. Sure. It's complicated.
Yeah. Thank you so much, Lisa, for sharing those. If we can now go to our phones, we have Annie from Texas who has called in to kind of add on to some of the discussion around arrhythmia and actually some kind of unique impacts. So, Annie, are you with us?
I am.
All right. If please feel free to share a little bit about yourself and the impacts that arrhythmia has had on you and your life.
I wanted to reiterate what Ben was saying about the palpable arrhythmias and the sheer force. And it also ties into the other symptoms that weren't on the panel options.
Yep.
Because of that pressure and the increase in your internally, it makes it difficult to even hear in conversation sometimes, which limits social interaction. Because you're constantly asking people to repeat themselves with all the internal noise that you have.
And is that...
So that can be very frustrating.
Is that impact on hearing, is that just during that time where there's that palpitation or arrhythmia, or has that become a permanent impairment?
It's increasingly worse when you have the palpitations.
Okay.
It's kind of always there, but it's almost impossible to carry on a good conversation with somebody without constantly saying, huh, what, when you're having the actual palpitation.
I'm going to add to
that, Which makes it hard to focus in any situation.
Absolutely. The very first thing I noticed when I opened my eyes after my heart transplant was how quiet it was. I had never heard silence like that since I was 12 years old. It was amazing because I constantly heard my heartbeat, like behind your ear. You would just have this pounding all the time. And when you're having PVCs and arrhythmias and it's all out of the whack, it's not a smooth rhythm. It's very unsettling. And it was very odd to be quiet.
Sure. Annie, for you, has it got?
I haven't experienced that yet.
Well, for the hearing loss you have experienced, has it? You said it gets worse during those palpitations, but has that gotten worse over time? Is it getting harder and harder to hear over time, or is it pretty much the same? At least for kind of the last period of time in your life.
No, I think it's pretty much the same. I can remember even as a small child, I had to have hearing testing because they thought that I was hard of hearing. So I think it's been the same my whole life. That was even before I was diagnosed or knew I had any issues.
Sure. No, that's very helpful. Thank you so much, Annie. We have another phone caller that wants to share some about the impacts on life. We have Kristen from Maryland who wants to talk about her and her daughter's experience. Kristen, are you with us?
Yes, hi.
Hi, Kristen.
Hi, can you hear me?
Yes.
Hi there. Just want to make sure you can hear me okay.
Yes, we can hear you loud and clear.
Oh, great. Okay. So, yeah, I wanted to call and let you know my experiences. I had a sudden cardiac death when I was 19 and was, you know, there's not a great percentage of people who live after that. That was, really, of course, life-changing. I was able to live fine. I traveled, I exercised, but not at the same level as before. And then the time came to, I got married, and I had to make a decision, do I have kids or not? Because I knew that you could pass this on. So this wasn't a surprise for me. I knew it, and we decided to have kids anyway, because even if they got it, you know, I was able to enjoy my life. But it's still a burden to have to face that and know that you could be passing on something that could restrict somebody. So we had 2 kids. One has it, one doesn't. And the one that has it experienced sudden cardiac death. And that was life-changing as well, but she lived. And so we're kind of a case in, you know, we beat all the odds because both of us lived a very difficult kind of circumstance. And we support each other, and that's a great thing, but we're really looking forward to developments in the future that provide a way for people with this condition to live without that difficulty walking up the stairs, or when you just feel like going to exercise that you can. These are, you know, we are alive. We're always thankful for that, but there's always this burden of, gosh, maybe I can't keep up with everybody else. So that's what, that's the kind of experience I wanted to share.
Sure.
Thank you.
Yeah, thank you so much. So, you know, we have about 15 minutes left in our session, and so I want to make sure that we get to our final discussion question. And I think it you know, flows really nicely from that last call, which is thinking about kind of worries for the future. You know, there's lots of things that we've heard about you that have impacted you in the past and impacted you today. But we've heard kind of as a little bit as part of all of this that there's certain fears that you have, maybe about those symptoms and new symptoms that might come, or symptoms that might get worse, or fears of heart failure and ultimately death. We've heard about different things that, you know, frustrate you in day-to-day life, and, you know, that those things might, you know, be some of your worries and your fears. So we want to spend some time now, you know, kind of thinking a little bit more about the future and what it is that you're concerned with and worried for. And so I'd like to go to our Zoom panel again to kind of start us off on this. Before I do that, I just want to remind you that if you have a comment that you would like to share by phone, that you can dial in. The number for that again is 1-703-844-3231. But to get us started on this conversation about worries, I'd like to ask if our Zoom panelist, Nikora, could share her thoughts about worries and frustrations.
Hello, everyone. So one of my big concerns is that African-American mom of twins. One of my twins does have HCM. He has been an avid athlete, had a scholarship to private school, and travels the country in AAU basketball, which is the amateur athletic league. We did not know or have any idea of what HCM was, but he had an asthma attack on the court one day, and then after doing some clinical trials and testing, we found out that he had HCM. Now, what was bizarre with that is that we have seen athletes on the court pass away, but we were not aware really of the disease or what the outcomes were. So essentially, one of the fears for me has been, one, learning to research and figure out what is it that I can do as a parent for my child to prevent sudden cardiac arrest. And so I had to do a lot of research, and I found that there wasn't a lot out there, and I would get different answers from different doctors. And so when you as a parent are trying to advocate for your child and you're getting different information from different people, it gets difficult. So my son would constantly say, I don't feel any symptoms and I'm okay and I should be able to play. So one doctor said, oh, he could just have a large heart. Yeah, maybe he could play. But I just was like, that risk of death is not okay with me or his father. And so then we found out that there was a high instance of African Americans that have the disease, and we were not aware of that. And so we tried to advocate, my husband and I, as he's a coach for AAU, to try to get them to understand and get the awareness out there that, hey, you could have this disease and we should have testing before these kids. You know, sometimes in the gym, we would have 5 games in one day. So think about a kid with HCM doing 5 games. So by that 5th game, if a kid collapsed, we now see why. And then just now, like with the Black Lives Matter and people protesting, all of my children wanted to go out and protest. And my biggest fear for him was, you're a boy of color, and what if you get tased with HCM? That would be horrific. And so I was like, you already have the heart, the asthma for COVID worries, but then if you got tased, you know, not that you want to think that way, but as a parent, I had to think that way, and I had to prevent him from doing those activities. And so I then found out he doesn't have an ICD. Like, I listened to the 2 younger people on the callers talk, and I think that I might have some reassurance, like if he had an ICD. But after going to a co, I learned that he's only at level 1 per se, even though he still has the risk. So he can't have the ICD, but we had to get a defibrillator. Well, a defibrillator is a lot of money. So then there comes the cost and the research and parents trying to figure out how to get that covered if your insurance didn't cover it. I happened to work for the healthcare plan, but even I had difficulty getting it approved when I wrote the plan and was told, no, it's not covered. And then, you know, after going back and forth and standing my ground, I was able to get it approved. But that was like a $8,000 defibrillator. I then had to go to his private school because it's not like public school where the defibrillator was right in the gym, and say, hey, I now need to give you this paperwork, and you need to be aware, every single teacher that the defibrillator needs to be in walking distance of all his classes. But it was so weird for me because I had to again do all the research, all the legwork, and even fight the doctors, because one of them wanted to do a thing on him and said he has Tuskegee and said that, you know, there was not oxygen. And then the co-center was like, no, he doesn't have that. You're fine. He just has this. So I think that vigilance, as a parent, you have to be vigilant and you have to educate yourself and get more aware. Luckily, my husband and I have a doctorate. He has multiple degrees. We were educated enough to do that. But what about families that are not? And so I would hope the FDA especially would try to get research funding to continue to get education awareness out there, work with these groups like AAU, and work with like the HCM Association and different places to get the awareness out there, because a lot of communities are not aware. And secondly, I would hope that more funding would go into more research on medications, and then funding for, you know, the biomedical research, because my son initially had no symptoms. He still doesn't have symptoms, but every 6 months, there may be a little change. So first he had HCM, now he has HOCM. And so as a parent, I'm like, okay, what is that? What's going on? Oh my gosh, there's a change. And so you worry about those changes and how you will proceed and navigate the future.
Sure.
But for all the calls that I've heard, everybody's fear is death and just the quality of life. But I would hope that we would get more awareness to our plight so that we can try to give our children's a better life.
Wow, Nikor, thank you so much. And it's, you know, incredible, you know, a mom, you know, where you're not talking about burdens of the symptoms themselves, you're talking about an asymptomatic situation, but the number of worries and concerns in day to day are still enormous. So thank you so much for sharing that. While we're on kind of the talking about concerns and burdens from a parent's perspective, we actually have Danielle from Virginia who's on the phone, who wants to share some of her thoughts and talk about the concept of guilt for missing out. So Danielle, are you with us?
I am. So I'm Ben's mom. So he was just on not too long ago. And so he had his first cardiac arrest last year when he was a sophomore in high school. And first of all, he always, was the healthiest kid. He never had a cold. He always had great physical checkups. And I have to tell you, when I got the call from the school telling me to get to the hospital immediately, I was shocked. That my kid had gone into sudden cardiac arrest, and the only thing that I thought is like, my kid doesn't do drugs. Like, what could possibly be the thing? And my kid's a straight A student, right? What's going on? Well, my kid is a very good kid, but he has. It turns out that he had hypertrophic cardiomyopathy that I never caught, and the physicians never caught. He was totally asymptomatic. But I have to tell you, after that experience, I kind of, have gotten a little bit of PTSD, if you will, because, like after, sometimes, as a teen, he might sleep in, or there'll be times when I had expected him to be home and I come in the house and it's quiet. And the first thing that goes into my mind is something's happened to my kid. And, it creates this, terrible anxiety, for me, not because I want it to be there, but, having him now had 2 sudden cardiac arrests, and, the doctor said, he could have many of them. And, we're relying on the reliability of essentially an ICD, which, hopefully will work, but, we don't know 100% if it's always going to work or, all of that stuff. So there's a lot of anxiety that goes along with that. And just even, as some of the parents were talking about, like the decisions that have to be made, after he had his second cardiac arrest, he had initially, after his first one, the doctor said, okay, he actually can, now that he has an ICD, you can let him, go to start driver's ed. But the problem was, after the second one, and he lost consciousness, do I really want my kid to be driving, right? A new driver getting on the beltway. And we know, how important that is for a teen, right? To learn how to drive and to become independent. And I kind of feel like I've
So what did you decide there? Have you found a way to?
I haven't. No, I mean, and now with COVID, right? He can't do I can't let him go into a taxi or a Uber, right? So I'm going to be the caregiver constantly because he's got, wherever he wants to go, I have to drive him, right? And I can't. He's not going to be able to take Metro for a really long time. Not that he's going out; he's pretty isolated. But this is going to be a really big impact, and I don't think that he really realizes all the repercussions of the disease. We talk about it, but it's kind of hard to grasp. I think.
No, that's tremendous.
For somebody so young.
It is tremendous, and I will say that having spoken to your son for just a few moments, I think you guys are on the right path, and I'm looking forward to speaking to you both when I get back to the office. And we really appreciate your call today. We want to get a couple more comments in before we go to break.
Yes, please.
I have some comments that have been written in about the burden of disease in terms of worry and what people are thinking. And Cynthia from LA comes from a 3-generation family with HCM, so it's when we're dealing with our own HCM, it's one set of issues. When you're dealing with your parents and siblings, it's a whole second set of issues. When you're dealing with the generation before you, you and your children with HCM, things get a little hard to handle, and that's what she's dealing with. She's terrified about what the future holds. There's no good treatments specific to hypertrophic cardiomyopathy in terms of drug therapies, and she's at a risk of heart failure. And she worries if that's going to happen to her, and are there stroke risks, are there heart failure risks, what will come next? And will there be a drug there in time or a therapeutic there in time to help stave off those types of complications? And Trudy from South Hadley, I don't exactly know where South Hadley is referring to her concerns of shortness of breath and atrial fibrillation being terribly frightening, and that these symptoms can cause a sense of terror. And I know that when you go to the emergency room, sometimes they'll say, "How do you feel?" And impending doom is a very real thing to those with HCM. You feel like life might just slip right away from you. And it's something that happens very frequently. Lauren is commenting on something a little bit different here, which I have to say is somewhat comical but real life. She went into atrial fibrillation in a restaurant and once while having a manicure. Now that would really upset me to have my manicure interrupted by atrial fibrillation. So I hear you, girl. But she chooses her date nights based on the location to a hospital. You worry about having a manicure and going into atrial fibrillation. This is real life with HCM, and these are real worries because real life includes all of these parts of life.
Yeah, thank you, Lisa. So this has been incredible. I think we've had a very fulsome discussion of what it is to live with HCM, the symptoms and the impacts on daily life. This is only half the conversation. We have a whole conversation to have around your approaches to treatment, all the different things you're doing to live and manage with the disease, and also your thoughts and your preferences for future treatments. And we'll be tackling all of those topics in the next session. So I want to thank our Zoom panel for joining us for this discussion.
Thanks,
We're going to be going on a 30-minute break, coming back at 12:45. But before we do, Lisa has a special announcement.
So yesterday, we had the opportunity to meet with somebody very important to the HCM community. And I'm going to make another announcement on the other side of the break, so you better stay tuned. This letter that I am holding, and I'm going to bring it up here, this is the actual first letter, the original, of the first diagnosis of hypertrophic cardiomyopathy. The gentleman's name is Claude Brady. He lives a town away from where we are right now, and he was here in the studio with me last night recording a little interview, which you're going to see on the break. That will also be later available on the HCMA website. This letter has been in his family since September 18th, 1959. And he was here with me today. He is 83 years old, or yesterday. He's 83 years old. This is a letter from Dr. Eugene Brunwald, and anybody who knows cardiology certainly knows Dr. Brunwald. And Dr. Brunwald originally diagnosed him as having a family history of this Brady disease, they were calling it for a little while. Originally, they called it functional aortic stenosis. Then it turned into idiopathic hypertrophic subaortic stenosis, of what we now know today to be hypertrophic cardiomyopathy. So I hope during the break you will truly enjoy my very raw and real conversation with Claude Brady, who is just an extraordinary West Virginian with a wonderful accent and a fantastic outlook. I hope he inspires you like he's always inspired me. Now we're going off. Hi, it's Lisa Salberg, founder and CEO of the Hypertrophic Cardiomyopathy Association, with an incredibly special guest here with me today. This, ladies and gentlemen, is Claude Brady. He is the very first patient ever diagnosed with hypertrophic cardiomyopathy on September 18th, 1959. And we have documented proof, which will be available on the website shortly, in a letter from Dr. Eugene Brunwald diagnosing him all those years ago. Claude Brady, it is absolutely delightful to be sitting here talking with you today and sharing your story with our community. So why don't you tell us a little bit about that Brady heart of yours?
The Brady heart. I'm 12 years old, back in the central part of West Virginia. The old doctor took one listen to my heart, and he says, well, I don't know what it is. I call it the Brady Lemons heart, but I don't believe there's a doctor in the world that knows what it is. That doctor was smarter than we knew. He took care of me until we left West Virginia and came down here in Arlington, Virginia. And then it was to find a doctor who knew knew that I had a heart condition, didn't know what it was. Finally got in touch with the right doctor, and he got me into NIH. And getting into NIH is not an easy process. You got to be different.
Unique?
Somewhere unique is it?
Unique.
So I got over there at NIH. First day, they put you through a little bit of a rigmarole and all the weight and everything. The second day, they did a heart cath. And the third day, they did a heart cath, and they put me into fibrillation. I got a scar across here to prove it. Their machine would not take me out of fib. So, I can't think of his name right now. Opened me up, put his hand in there for 17 minutes.
Dr. Brunwell or Dr. Morrow?
No, or neither one of them.
Okay.
I'll think about it and I'll tell you later. But it was just one of the surgeons in the cath lab. 17 minutes. He kept me alive. And they couldn't stop it because their defibrillator wasn't strong enough. They finally got another defibrillator or something, and they threw a handful of antibiotics in there and sewed me up and put me on you ever been on a refrigerated mattress?
No, sir, I have not. That's how they treated you.
You will freeze to death. You can't get warm. They finally, they got me out of there, and I eventually they saw me at NIH, and I said they were in seventh heaven. They found something that was new and different, and no one knew what it was. And I went through, I don't know how much stuff before Bromwald named it, and he didn't name it hypertrophic. Asymmetric septum hypertrophy, I think he called it.
I think you were asymmetric septal hypertrophy or possible functional aortic stenosis.
Yeah.
Were the names that they originally placed on you.
Yeah.
So your brother and your sister were also affected.
Yes.
And anybody else in the family?
I have a niece who had it, and she was admitted to Duke, which is not an easy school to get into. She was studying to go to Duke. She jumped up from the couch one night and ran up the steps and dropped dead right there on the steps.
So sorry.
My brother would tell you having a daughter that drops dead is one thing, but to be the mother of that daughter is altogether different. The mother really feels it deeper than the father does. So eventually, let me see, from 59 to 89, there came a time in 83 that I was sick enough I couldn't do my job. So they retired me on disability, and I waited 6 years before I was sick enough to get on the list
for a heart transplant. Let's stop there for just a second and go back. What medications had you been on?
Oh, Christ. The first thing that I remember is Amuran.
Amiodarone?
Yeah, you remember that?
I do. Still use it today.
Are you taking it now?
I'm not. Other people do.
I haven't had any of it in a long, long time. There was a kidney doctor who was famous for saying that prevented rejection. We had something else that we were taking at the time. But he was a kidney doctor, and my doctors listened to him because I'm here,
Did you ever take beta blockers or calcium channel blockers?
Oh, I
took
all of it, I mean, in 31 years that I can tell you that I have taken care of myself or I wouldn't be here. I didn't drink. I didn't smoke. And if you give me some time, I can dig out the literature and I can show you guys that did, and they're no longer here. If you can't do what they tell you to do, you can be in trouble. There was 2 of them at Hopkins that they liked to party, and neither one of them are with us still.
So you've lived a clean life, you've eaten well.
Tried to.
No
Lied a little
smoking, no
bit.
drinking?
Huh?
No smoking, no drinking?
No.
Good.
No. I've got 4 beers in my refrigerator that have been there a whole year. I will drink one occasionally, but I...
Would you drink when you had HCM or just after your transplant?
No, I didn't. No.
No, never.
No, I'm very cautious about what I put in my body.
Very good.
Needless to say, the most important thing that ever happened to me was I married a woman.
She was your rock.
Really a terrific woman. High school graduate, a year of secretarial school, ended up in the Pentagon as Secretary of the Secretary of Defense.
Wow.
Never misspelled a word in her life. Knew, and I can't spell worth a damn.
Okay.
I mean, we were definitely opposite. She had 2 kids from a gentleman in Texas, and he didn't treat her right, so she came back to Arlington, and
you won.
Yeah, from 1966 on. Needless to say, she's been gone for 21 years now. Hopkins did a heart transplant for my brother, 09 or sometime through there.
Mm-hmm.
They did a heart transplant for me, whatever, 89.
1989.
And they did a bone marrow transplant for my wife, what year? 98.
Wow.
So
A
we
lot
are,
of transplants in your family. A lot of different transplants
yeah,
in your family.
my brother had his heart transplant before I did. He lived 16 years. Cancer got him.
And your transplant was 1989, so you're how many years out now? Almost 21?
31.
31. Bad math.
31. The 20th of this month for 31 years. This year had, for some reason or another, it's meant more to me than most other years.
That's a big milestone. Not many transplant patients make it 30 years post-transplant.
But Hopkins has more than one. That's 31. They've got one lady that's 34 years.
Wow. I've seen her written up, yes.
Yeah.
So if there's anything, you lived with HCM for 30 some odd years, then you lived with a transplant for 31 years. What messages would you give to, I'm going to be very specific here, to drug manufacturers and to the FDA about what they need to know about making better medicines for HCM? Let's pretend you still had your HCM heart in you. What would you want out of a medication?
Well, we got lucky when Novartis stepped in with their Prograf.
Mm-hmm.
They had another drug. I was on Imuran and something else.
Cyclosporin?
Yeah.
That's for your transplant life, yeah.
Yeah, and I did all right with that. Luckily, my body accepts these drugs.
Mm-hmm.
And some people can't handle them.
Right.
They just have a problem for whatever the reason. A lot of it's mental. I believe that. But see, when I was 12 years old, I thought, my heart's not going to kill me. I believed that till the day Hopkins opened me up and gave me another one. So that old heart is gone. It didn't kill me. I knew it wasn't going, it's faith. I'm not the guy that goes to church every 4 or 5 times a week. I don't go to church hardly ever. But I just knew that I was going to be all right, and I lived like I intended to. So.
Sounds like you have a lot of faith in science and technology.
Yeah. The best part of the whole deal is the doctors were super interested in because of my history.
Right.
They wanted to know me and what I've been through. I mean, I've been through this, lots of times with different doctors. And the good ones something always happens to them. They get hired away.
Yeah, they do move around a lot. That's kind of annoying.
Yeah.
So if you had something to tell, how old are you when you were diagnosed? 27, 28 years old?
When they knew the diagnosis.
When they knew the diagnosis?
26.
26 years old.
Yeah.
So if you were to give a message to the 26-year-old Claude with everything that you know today, what would you tell 26-year-old Claude?
Well, the first thing I would say is listen to what the doctors tell you and live by that. They didn't think it was a good idea to be drinking very heavy. A little wine now and again, that's okay, but I don't even do that. They're just in my bones. I just don't want to do it. I just want to live a nice, calm, cool,
Quiet life?
Yeah.
Okay.
And I have, when you get to know some of my family now, you'll find out that I have been, and I don't understand how. I married this gal from West Virginia, and she was a GS3 or something in the Air Force. And in the end, she was Secretary of the Secretary of Defense. And then she was his secretary in private life for several years. How I got so lucky, and today the person who brought me here, same thing.
Family's important to you.
Somebody is looking after me. I believe that. Not only in my family, but somewhere or another, the good Lord is saying, mind your P's and Q's and I'll take care of you. And I don't believe you've got to go to church and pray and all that stuff. I believe you just got to live the life that you know is right. And if you think it's not right, then you need to change it. I didn't have to change very, very little.
So I'm going to wrap up with a couple of thoughts here, Claude. So I think you're here for a reason. I agree with you. And I know that you're going to be an inspiration to anybody who watches this. They can't help but be inspired by that story. You were diagnosed in a time when there was no treatment, no good drugs, very limited technology. You benefited from a lifetime plus of development of drugs, therapeutics, transplant technology, transplant medication, and you're here today.
Yep.
And I want to tell you that effective immediately, September 18th of every year is going to be the official Claude Brady Recognition Day at the Hypertrophic Cardiomyopathy Association. And every year we're going to celebrate you and what you mean to our community. We think you are fantastic, and we thank you for sharing your story with us today.
Happy to do it.
Thank you.
To do it.
Now, if that isn't inspiring, I don't know what is.
Hello, my name is James Valentine, and welcome back to the externally led patient-focused drug development meeting on hypertrophic cardiomyopathy. As you remember, for the break, we had a special announcement and a special guest interview. I want to pass it back over to Lisa to finish out her special announcement.
Why, thank you very much. I hope you were all as inspired by Claude Brady as I have always been. And I wanted to take this opportunity to announce a new special day on the calendar of the HCMA, and it is September 18th. From this day forward, that day shall be recognized at the HCMA as Claude Brady Recognition Day in honor of his inspirational journey with HCM and his willingness to share his journey with all of us. So look forward to some special events around September 18th from this point forward. Back to you, James.
Thank you, Lisa. So now we get to dig into our second topic of the day, which is getting an understanding of your experiences and your perspectives on current approaches to treatment, as well as your thoughts and preferences about future approaches to treatment. So in this topic, we're going to try to tackle a number of questions. We want to get an understanding of what it is that you're doing to help manage your HCM symptoms. That includes not just prescription drugs that you might be using, either to treat the direct manifestations or the symptoms of the disease, but also medical procedures. Certainly that includes transplants, but can include many other things, as well as other things you might do to try to help relieve yourself from the burden of symptoms, whether that be different types of therapy or diet and exercise, as well as lifestyle modifications that you might have to make that just helps making living with HCM that little bit easier for you. So we want to try to tackle and learn from you about that broad range of what we're calling treatments, approaches to treatment. And in doing so, we want to know both what has worked well for you. So how have those different treatment approaches helped with those symptoms, helped you live and participate in activities in your daily life? But we also recognize that almost no treatment comes without some trade-offs. So we want to understand the burdens, that might be side effects, the time that it takes to get treatment, the recovery from those different treatment approaches that you have. And then once we kind of understand your experience with treatments that are currently available, we're going to look towards the future. And while we certainly all would want a cure for HCM, we want to kind of explore short of that cure, what are the specific things that you would look for from that next treatment? What would be an ideal treatment to you? So like before, we have a panel of patients and caregivers to start off and share their experiences with us on this topic. We have Kent, Ashley, Tracy, Kelly, and Scott, and we'll turn it first to the video from Kent.
My name is Kent Sperry. I'm 46 years old and live in Beulah, North Dakota with my wife and 6 children. I'm the pastor of Prince of Peace Lutheran Church and am part of the Association of Free Lutheran Congregations. I've been in ministry for 22 years now. When I was diagnosed with hypertrophic cardiomyopathy almost 10 years ago, my wife was pregnant with our 5th child. Being told that this condition is passed on genetically and that each of my children had a 50% chance of inheriting it, that hit me pretty hard. It was frightening to consider this reality and what it could mean for them. There were the feelings of guilt, realizing what they may have to endure because of me. And when my wife and I considered a 6th child, there were the questions. Is it fair? Is it selfish to have a child when they have a good chance of inheriting this condition? I first became aware of hypertrophic cardiomyopathy when my father was diagnosed in his mid-50s. His cardiologist recommended that I be screened right away, and although I was screened, it was missed. I felt fine, however, so I didn't think too much of it. It was a few years later, when I was 37 years old, that I developed symptoms. I was experiencing fatigue, chest pain, shortness of breath, and palpitations. My heart would race if I just stood up, and I would at times come close to passing out. I was no longer able to do things like work out, help my kids learn how to ride a bike, or engage in simple home maintenance as they worsened my symptoms. Even with my father's diagnosis, however, I was repeatedly told that I was fine. It was only when I saw an electrophysiologist who had just opened a practice in our area that I was diagnosed. I'm not a candidate for surgery because I'm mildly obstructed with no risk factors for sudden cardiac arrest. I've been treated with medication for symptom management. I was initially put on a low dose of metoprolol, which helped greatly for about 2 years. I felt almost normal and experienced only infrequent symptoms. But at that point, all of my symptoms returned as severe as ever, even while on this medication. It was then that I made my first trip to a center of excellence and was switched to verapamil. Now, this medication, it has managed my symptoms to a large degree. That being said, I feel far from normal. I'm still limited, meaning I have to be careful not to push myself too hard. I experience mild symptoms most days, and my symptoms, they can suddenly worsen for unexplained reasons. I can take a walk one day and have no trouble at all, and I can walk the same path the next day and have trouble making it through. I've also found that stress will cause my symptoms to worsen. It can be a difficult week at work or family stress that will do so. And once my symptoms worsen, it will often take a good week before I begin to feel better. Because my job isn't terribly physical, my condition doesn't affect it all that much. Even when I don't feel all that well, I'm generally able to push through. I just do what has to get done and go home and collapse. Because I look normal, it's hard for others to understand what I'm going through. It's hard for them to understand why I can be so busy and active one day and not the next. It's hard for them to understand how I can do so much during the day but be so tired in the evening. This is hard even for my wife, who has watched me live with this for the last decade. And it doesn't help that I generally hide how I'm feeling because I don't like talking about it all the time. I submitted to gene testing to see if they could identify the responsible gene, and it was found. We then went on to have our children tested, and we discovered that our 2 boys and our youngest daughter are gene positive. My children who are gene positive are 16, 9, and 6 years old. So out of our 6 kids, 3 are gene positive. I guess we're the textbook example of that 50% statistic. None of my children are displaying HCM physically, at least not yet. And for this reason, they are not being treated. We do, however, have them screened regularly at a center of excellence. As we don't have one in our area, this means traveling. It means setting aside the time and the money to make this trip most years, a trip that involves a 9-hour drive each way, several days in a motel, and meals, on top of our medical expenses. There have been times when this has been a financial strain on our family, but I wouldn't do it differently. I believe that getting my children as well as myself to the right doctors is a must. As I think about treatments I'd like to see, I would like to be enabled to live free of these symptoms. I would like to live life without having to consider how simple actions and typical stress will limit me in the days ahead. As my father has dealt with AFib, I would like to see treatments that can either prevent this or stop it from occurring completely. And as far as my children are concerned, I would like to see treatments that will enable them to live a life as normal as possible, with as few limitations as possible. And although it seems distant, I maintain the hope of a cure as more is learned about this condition and as technology advances.
Hi, everyone. Thank you for being here today and listening to our histories and hopes for future treatment. I'm Ashley Fisher, a mom of 2, wife, and attorney from Baltimore. Growing up, I was active and participated in typical activities such as PE classes and riding bikes with friends. In 4th grade, I was deemed the fastest runner in my grade, and I felt pretty proud of that achievement. As I got older and tried to remain active, I noticed that I became increasingly short of breath and experienced tightness in my chest when I ran even at a slow pace. As I entered my mid and late teens, I attributed this discomfort to being out of shape and not exercising enough, not realizing at the time that I had it backwards. I was less active because it hurt to be active. At around age 19 or 20, after a nurse picked up a substantial murmur during a routine checkup, I followed up with a cardiologist and was diagnosed with HCM. The diagnosis at the time was not a relief, but it did at least offer an explanation as to why I had never been able to condition myself to be the runner that I wanted to be, and why a simple walk across my college campus left me short of breath. A few years passed, and I exhibited even more symptoms of HCM. including shortness of breath upon exertion, chest pressure, and presyncope. These symptoms and the progression of my hypertrophy indicated that I needed a life-saving ICD. My first ICD was implanted in July 2002, and I began law school the following month. I married in 2005, and while dancing at my wedding reception, I had 6 shocks from my ICD. I was strapped to the EKG machine when the paramedics came. It was quite a sight. Still, after this near-death experience, I considered myself to be a healthy person who could do whatever I wanted, with the exception of a few exercise restrictions, staying well hydrated at all times, and regularly taking medications. Even having children felt doable. The electrophysiologist who managed my ICD counseled me that I could have children as long as my pregnancy and delivery were managed by a high-risk obstetrician. I followed this recommendation and had a healthy, comfortable pregnancy. The delivery was hardly normal, though. I had what was called an assisted delivery, with the OB dilating me with her hands from 2 to 10 centimeters over the course of a half hour, and residents sitting on the bed with me, pushing my baby down from the top of my belly. We got the job done, though, and I had a beautiful baby girl. I continued life as a new mom and full-time litigator. But a little over a year later, I had a couple incidents of ventricular tachycardia that were very scary and resulted in shocks from my ICD. After this, I began experiencing symptoms akin to PTSD and sought therapy because I thought every single day I might be shocked. Still feeling like I, not HCM, was in control of my future, I became pregnant with my second child against the advice of my cardiologist. While she was concerned about how I would tolerate another pregnancy, she supported me and monitored me carefully. Despite our best efforts, though, my water broke when I was 25 weeks pregnant. And from then on, I was on strict bed rest in the hospital for 4.5 weeks, away from my 4-year-old daughter. My son was born at 29 weeks and spent 2.5 months in the NICU. He is now a healthy and cheerful first grader, nothing short of a miracle. And as a bonus, he is tested negative for HCM. After giving birth to my son, testing confirmed that my condition was progressing to the point that I needed to have a myectomy. I had class 3 heart failure, with shortness of breath from walking up just 1 flight of stairs and constant fatigue. It was only after having a significantly preterm delivery, undergoing a myectomy, and recovering from such a major surgery that I fully appreciated that my HCM was an aggressive type, which was confirmed by genetic testing. All the disease management I had done by staying hydrated, giving up alcohol, and taking medications religiously was never going to put me in control of HCM. That said, I still wanted as much control as I could have, so I began eating a whole food plant-based diet, walking daily, and doing Pilates weekly to be as fit and healthy as possible with my limitations. In order to manage my stress, I also pulled back a bit on my 60-hour-a-week litigation career. These lifestyle changes have allowed me to remain active and to participate meaningfully in my life while managing my ongoing symptoms. I still live with shortness of breath, fatigue, and random life-threatening arrhythmia, but I feel better since making these changes. I've learned that in spite of having an ICD and being fastidious about my lifestyle, I'm not guaranteed a symptom-free, healthy, or long life. But I, like any parent, want to be around as long as possible for my kids. In my case, and specific to our discussion, I need to be present for my 12-year-old daughter who gene tested positive for HCM and already shows some hypertrophy on echo. What I want for her is a life that allows her to be a runner if that's what she wants, or to keep skateboarding without feeling winded. When the time comes, I want her to have a healthy full-term pregnancy and delivery. If she takes medicine to manage her HCM, I don't want her to feel tired or sapped of energy every single day. I don't want her to fear that her medicine is not doing enough to improve her symptoms or to save her life. As she recently told me, "Mom, I don't mind if I have to take pills like you, but I want to be able to run around with my friends and not be out of breath." Thank you.
I am Tracy Argandonia. I live here in the DC area in Alexandria, Virginia with my husband and my 8-year-old daughter. I learned that I have HCM 2 years ago, and since then I have been on a variety of medications and had 2 surgeries in an attempt to treat my condition and feel better. I was diagnosed not long after my brother passed away from dilated cardiomyopathy. We didn't know what the origin of his was. We think it might have been HCM, but we will never really know for sure. As my brother's heart got worse, I started to see my own symptoms. And eventually he received approval for a transplant. He received a donor heart, but at the time of his transplant, it was just too late for him. At the same time, I was experiencing my own issues with shortness of breath, fatigue upon the slightest exertion. Of course, I didn't want my family to know that. So when I received my diagnosis, I was just a mess. I'd lost my younger brother. I didn't know it was causing my own heart problems. And I was afraid that my heart condition was going to follow the same path as my brother. I couldn't even go to the doctor without breaking down in tears. So a test for familial cardiomyopathy was suggested. I took it, and of course it came back positive, which was terrifying and yet also a little bit of a relief because I finally knew what was wrong with me. So my next step was to take a cardiac MRI to take a look at the scar tissue on my heart, which was pretty frightening. I didn't want to think that I had any scar tissue on my heart. And when the EP told me that 10% of it was covered with scar tissue, I got pretty scared. I mean, how is it still working? What did that mean? Was I going to go into sudden cardiac arrest? The next exam I had to take was a stress test. And after this one, I learned that I had an abnormal response to exercise. So when I exercise and my heart rate goes up, my blood pressure goes down. And if I were to exercise too much, then my blood pressure would drop and I would pass out. So my cardiologist actually told me not to do too much cardio because it wouldn't help me get better, and I just needed to hope that I wasn't going to get worse. So now my cardiologist and my EP were both telling me that they wanted me to get an ICD implanted. I was scared. I became very depressed. I was approaching the first holiday period without my brother. I learned that I had a progressive heart disease as well that was getting worse. And now apparently I had 2 doctors who were afraid I might drop dead at any time. So I made an appointment to get the ICD and celebrated my 46th birthday in the cardiac cath lab in January of 2019 to get my ICD. I had been full of anxiety leading up to the surgery, but when it was done, I finally got a little bit of relief. At least I knew if something bad did happen, I'd be likely to survive it. But I wasn't ready to accept that it was never going to get better. So I did a lot of research. I found the HCMA, and I referred myself to a center of excellence where I found a specialist in HCM and learned that there actually were options that could help improve my condition. So I started to have hope again. Over the next 8 months, I tried medications. We took me off the ones that I had been on, tried different doses of metoprolol. After several months, eventually added verapamil, but I was still fatigued all the time. I wasn't getting any better. The obstruction was getting worse, and I was more and more tired all the time. I had been sleeping most of the weekends. I would come home from work too tired to play with my daughter. I was even avoiding going to concerts or sporting events just because I didn't think I could handle going up the stairs or standing for a long period of time. Eventually, I was diagnosed with anxiety and depression. After researching myectomy as a treatment, I finally decided that I was ready for surgery because I was just tired of living that way. So in January of 2020, I had my myectomy surgery. I spent about 5 or 6 days in the hospital after it. I don't really remember most of it. The first few weeks of recovery were very hard. I was in a lot of pain from the incision. I had even more pain from where the drainage tubes had been. I also ended up back in the hospital 2 weeks later with a very large and painful blood clot where the central line had been, and spent my second birthday in a row in a hospital room. But about 5 or 6 weeks after my surgery, I did really start to notice a difference, and I could see they were right. They had gotten the obstruction and it was gone. I felt like a new person. I started walking. I started cardiac rehab, but I was only able to attend classes for a week before they were shut down due to COVID. They haven't started up again, but I am walking at least 3 or 4 days a week through my neighborhood, tracking my heart rate with my Apple Watch. So I do feel much better than I did before surgery. It hasn't been easy. I've been in enough pain to visit the emergency room more than once. The blood clot in my jugular vein is slowly being dissolved, but it isn't gone yet, and I'm still on blood thinners. And last week I learned that the pain I'm having in my chest now is likely due to a hiatal hernia, but at least I know that my sternum is healed and I don't have any loose wires, unlike a couple of other patients I know who had some unfortunate complications after their myectomies. So even with the challenges that I faced in healing, the surgery was successful and the change was truly incredible. I really do feel like myself again. I just wish there was a non-surgical way to treat this condition because open heart surgery is so hard. There's so many more people out there like me who are postponing their treatment or choosing not to get treatment because they don't think they can handle the surgery. And I just wish we had options to treat us that were not as drastic as cutting you open and cutting a piece of your heart out. Thank you.
Living an active life in Alaska while managing HCM. This is my story. The first indication that things were not as they should be, my first child born in 1983. He was full term, had a low APGAR and markers for brain injury. Symptoms were missed and we didn't realize until he became an adult that his brain injury had a larger impact than originally thought. My obvious symptoms started with my second pregnancy, when I started active labor at 26 weeks. Up to then, I was clueless as to how HCM was shaping our lives. I had non-symptomatic rhythm issues after that pregnancy until I passed out biking up a hill. I was 34, in amazing shape, pulling a 72-pound load up a major incline, and it was easy. I was laughing when I passed out. 1 minute, I was so happy to be in such great shape, and the next, bam, I woke up and I told no one. Even more amazing, got right back on the bike, rode home, put the bike up, and decided I'll just jog instead. Was jogging up a slight incline later that summer, and I went down again. I finally went to the ER when I was having chest pains with full body cold sweats and jaw pain. I was diagnosed with IHSS in 1996, and it's now called HCM. In the 60s, my first cousin died from enlarged heart at age 12, and we lost 2 uncles at age 50 from sudden cardiac death. In the 70s, my brother died, SCD, age 37. Since 2010, we lost 3 nieces unexpectedly, 2 in their sleep at age 43 and 52, and another niece at age 45, 10 days after gallbladder surgery. Her brother had a major stroke at age 45. Another niece told me last year she's having palpitations. I'm not able to convince any of them to be tested for HCM. For me, I attacked it and chose Dr. Barry Maron. He saved my life, and he said, no more biking, hiking, and to avoid stairs till we can get this figured out. He said I should consider moving out of Alaska, and I said no. He said, well then, you better learn about HCM and find a doctor up there willing to learn as well. They recommended an ICD because of family history and recent evidence of sustained rhythm issues. I've been hospitalized for a blood clot, and I've had 5 ICDs. I still walk a tightrope daily, but my Sparkies, they give me a safety net. Yet in 2015, I had reached the lowest point in my emotional health. I was dealing with fluid retention, shortness of breath, fatigue, memory issues, full body sweating, more frequent and symptomatic arrhythmias, and a lack of appetite, weight, and muscle loss. I had ablation surgery in 2016, but I knew I was running out of time. With the HCMA's help again, I found Dr. Stephen Heitner at OHSU. Dr. Heitner told me we had done all we could, and the only option left, if the progression continued, was transplant. He said I should start seeing a team at OHSU because at the current rate of progression, it was a possibility in the near future. Around that time, I was offered an opportunity to sign up for the Maverick drug study. All I can say is my quality of life is so improved along with my depression and my mental health. Depression is gone. I still have many of the same issues, but they're manageable. The biggest improvement is less fatigue, memory is no longer in decline, and I'm back to thinking clearly. I'm happier because I'm living a full life again. I had stopped cooking, volunteering, cleaning, shopping, raising poultry, gardening, biking, hiking, walking, music, and more. I have my life back, and I have energy to spare. Thanks to Evelo and their electric bikes, I can ride again. Unfortunately, I need another electric bike. No one will ride with me. They can't keep up. The worst for me are the things I see my children go through with the disabilities from birth and in utero brain assaults due to low oxygen. No answer is given for that. Is it because of my heart's inability to keep up during pregnancy and delivery? We have a lot to learn here, and I'm unsatisfied and still don't have an answer. I worry for them a lot, and they both need to be tested for adult onset HCM. Neither have made it a priority. How will they manage with another diagnosis thrown in the mix? For me personally, fatigue, arrhythmias, and brain fog are the three that I can't bear. Today, all three are managed. Thanks to Mavacamten, I have a new lease on life. Thank you for listening and for the opportunity to make a difference. And I'm grateful for all you do so we can help all who come after us. Thank you.
Hi, my name is Scott Popches. I'm 53 years old, originally from New Jersey, but I've lived in Los Angeles, California for the last 28 years. I'm a husband and father of two, and I work as an executive producer and editor in reality and nonfiction television. I was first diagnosed with hypertrophic cardiomyopathy in 1990 when I was 23, following my father's diagnosis with HCM. For the first 5 years, I remained mostly asymptomatic. But in 1995, I experienced my first noticeable symptoms, a type of cardiac arrhythmia called supraventricular tachycardia. Since then, there's been nothing simple about my journey with HCM. I've had shortness of breath, fatigue, various types of arrhythmia, both atrial and ventricular, and in recent years, issues related to heart failure. I watched as my father's condition worsened, eventually requiring a heart transplant. I have been treated with various medications, had multiple radiofrequency ablations and cardioversions, a septal myectomy, and an implantable cardioverter defibrillator, the first one in 1999. While all of these treatments have been helpful, it's because of the ICD technology that I'm alive today. It was late afternoon in May 2016. My then 10-year-old son and I arrived to his Little League game, and I helped prepare the field. As I dragged the rake along the infield dirt, I felt strong palpitations that quickly turned into a rapid heart rate, along with shortness of breath and lightheadedness. As I knelt to the ground, I tried the Valsalva maneuver and forced a violent cough in an effort to return my heart to a normal rhythm. But the symptoms only intensified, and a feeling of uh-oh crept over me. The last thought I remember as I fell to the ground was, I hope the ICD does its job. When I came to, I was lying on my back and in a daze. I could hear my son screaming, "Daddy," and I could barely move. As I slipped in and out of consciousness, I was defibrillated 4 times. The shocks hurt, like a horse kicking me in the chest. And each time my vision focused into a bright pinpoint of light. Time seemed to stand still. I could sense people coming around me trying to figure out what to do. The coach talking to 911, the police helicopter circling overhead, and my son crying out as other parents tried to comfort him. After the 4th shock, I lay there silently, waiting for the next one and wondering when it was all going to stop. In the distance, I heard sirens from the approaching ambulance and took comfort in the thought that help was close. Thankfully, the next shock never came. Over a period of 94 seconds, my ICD shocked me a total of 5 times, not the 4 I remember. The first I learned came when I was unconscious in VF arrest. The other 4 shocks intervened to stop my heart from going back into VFib. Clearly, having an ICD saved my life. I am currently on my 5th ICD and managed with medications to control arrhythmias. I am also on Lasix to control symptoms of heart failure. I also use the cardiomobile monitor, a small ECG device that works with a smartphone, to take a 30-second reading that can be sent via text or email to my doctor for immediate evaluation. But with any treatment, there is usually a trade-off. Many of the medications I've used come with side effects that have ranged from annoying and disruptive to intolerable and toxic. The fatigue and brain fog from beta blockers make it difficult to focus or get through the day without taking a nap. There are periodic blood and pulmonary tests to make sure the antiarrhythmics, specifically amiodarone, wasn't harming my liver, thyroid, and lungs. And there's the fear of starting new antiarrhythmics, like sotalol, that can provoke the very arrhythmias they are supposed to control. The Lasix makes my long LA commute challenging, to say the least, and disrupts my daily work routine at the office with frequent and embarrassing trips to the restroom. I have even struggled at times to appreciate technology's value, often asking myself if the benefits were worth the price I was paying. Aside from the normal battery changeouts, I've had inappropriate shocks on multiple occasions. I had an infection of my ICD system that led to emergency surgery and a prolonged hospital stay. And my ICD leads have fractured multiple times, each incident requiring risky lead extraction surgery to remove and replace the faulty lead. For me, living with the complications and making lifestyle adjustments has been doable. I stopped competitive sports and found new hobbies and activities that were more compatible with HCM. Regular moderate exercise, hiking, biking, photography, and model aviation, to name a few. The emotional and psychological toll can be difficult to manage as well, not just for the patient, but also for the patient's family. Following the event at the baseball field, my family sought counseling that helped us work through the PTSD that came in the wake of that experience. But for me, the benefit of living to see another day far outweighs the difficulties, challenges, and speed bumps along the way. Looking to the future, my hope is that technological innovations will continue, and leads will become more durable, devices will get smaller, batteries will have a longer life or can be recharged, and communication between a patient's device and their physicians will be more mobile and accessible. And finally, effective drugs with less serious side effects that are specifically targeted at HCM and its complications will be developed. Thank you. Now, if you'll excuse me, I have to hit the restroom.
Oh, well, thank you, Scott, but thank you really to Kent, Ashley, Tracy, Kelly, too, for digging in and really sharing those treatment journeys that you've undertaken. So much there, and so much more I know we still have to unpack with our conversation. So as a reminder, this is the point where we're going to be asking all of you to participate. We'll have some polling questions throughout, so it's a good time to pull out those phones again or open up that other tab. But also to remind you that we'll be asking you to call in as well as write in with comments. We're going to start off with a discussion of current things and approaches to treatment that you're doing to try to help manage those symptoms and health effects that we learned so much about this morning. So, to start off, we're going to be asking you to describe to us some of the things that you're doing, or perhaps even things that you've tried in the past, and to try to understand, what it is that those treatments were intended to help with, how well they actually did help, as well as to understand any burdens or downsides of those treatments. And again, we're really interested in the broadest range of things that you might have tried, whether that's a medical product or a medical intervention or something outside of traditional medicine, even things you do in your own daily life to try to help manage. And so to actually kick us off in a discussion of this, we have our Zoom panel. But before we go to that, I'll just remind you that if you want to call in and provide a comment, we have a phone number that you can call. That's 1-703 844-3231. Again, that's 1-703-844-3231. And of course, you can also submit written comments in that comment form that is below the live stream that you're currently seeing. On this topic of current approaches to treatment, we want to get a sense of things that you're using, and we'll leave it open, kind of broad, to let you choose if there's something you want to share that's worked well, something you want to share that has had a significant burden, and maybe that's one and the same. Something that's helped a lot actually is quite burdensome too. So to get us started here, I'd like to go to Biller and have you share with us one of your treatment experiences.
Sure. Thank you so much for the opportunity. First of all, I have been diagnosed almost 3 years ago exactly. And when I started, I didn't have any symptoms after, the one incident that I had. That was the trigger. But the learning experience came after I had my second round of doctors, frankly, after being diagnosed and going through all the tests, etc. I have HCM. And one of the things that helped me, I'm on combination medication right now, beta blockers and calcium channel blockers. So they have their own adverse events, they have their own side effects, and I'm going to go to it. But because I was showing symptoms of progressing quite fast, and again, not having had any history before, the second set of doctors, which I'm super grateful, we started on log keeping. As my doctor said, you need to understand what's triggering anything in your body and what's happening, and so it can also give us clues. So, I mean, I'm a data-oriented person to begin with, but keeping daily. And if you see me looking at my head down a little bit, I'm going to tell you why I'm doing it today. I started very meticulously keeping my blood pressure log, my pulse rates, what I ate, what triggered after anything I ate, what amounts, and any kind of activity which also triggered that out of breathness, the hurt in the pain in your chest. So when somebody says what kind of a pain it is if you were out of, let's say, out of physical fitness and you ran a long time and you have to lean onto someone and to say, oh my God, my chest is really burning. And there's that sensation of I'm going to collapse. That actually can happen when you're going a regular flight of steps and halfway through, if you are not in your right day. So I was experiencing those, but we were logging them all and actually writing them. And every day is not the same as a person. I can get up one day feeling totally energetic, and I even forget that I have this disease, do something silly, and all of a sudden, boom, I will have my obstruction to remind me, what are you doing? Or I get up, it's a beautiful day, but you have to really kick me out of the bed because I'm so sluggish, feeling dizzy, totally out of this world, and want to sleep or rest, but it's not really a restful sleep. It's out of fatigue. So even with the medications that I am, going through my therapy, again, as a person, every day is different. I have my symptoms that I have to monitor. And as I say, I'm looking at my wrist because it's one of those days today. Right now, I'm excited because I'm speaking on Zoom, but my pulse rate is only 54. Because if I'm not, speaking and sitting back here, I'm actually logging very regularly 42. I'm like, when am I going to pass out?
Wow.
So again, you have no control over these things. And the medication that I'm on, or the combination medication, yes, it's giving me a relief, but this is not, a normal solution or a cure, if you will.
Sure.
And I'm sure we're going to get into the discussions of what are we expecting
That's right.
out of medications to be developed. But, the key things are naturally the side effects, the adverse events, and the sluggishness and the dizziness that we go through on a daily basis
Yeah, it sounds
has to be controlled better.
Yeah, I mean, it sounds, even with your treatment regimen, not only is it not giving you full symptom relief, but not even necessarily predictability. So thank you so much, Biller. So
Thank you.
having kind of warmed us up a little bit, now I want to get everyone else in the audience engaged. We're going to get a sense of what all of you who are participating live are currently doing to manage your symptoms. So if we can go to our first polling question. On approaches to treatment. So again, if you're joining us, if you haven't had a chance to participate in the meeting earlier, if you're a individual with HCM or a caregiver of HCM, we would encourage you to participate in these polling questions. You can pull out your phone, open up a browser, open up a new tab on your computer, and type in pollev.com/4HCM. You can see that right at the top of the screen right now. With these polling questions. So our first polling question of this session is we want to get that sense of what therapies that you have recently, being in the past 5 years, used. And we want you to check all that apply. So your options are A, devices like implantable cardiac defibrillators or pacemakers, B, beta blockers, you see some examples listed there, C, calcium channel blockers, D, antiarrhythmic medications for heart rhythm or obstruction, E, blood thinners, F, experimental medications such as part of a clinical trial, G, septal reduction or myectomy, alcohol septal ablation, or valve replacement and repair, H, invasive treatments of arrhythmia like ablation to treat AFib, surgical maze, or ablation for ventricular arrhythmia, or I, transplants, LVAD, or total artificial heart. So please, again, select all of the various therapies that you have tried or had to use in the last 5 years, and please select all that apply. You're seeing percentages. I'll remind you that because this is a question where you can select more than one option, you see percentages of responses, not the percentage of people who responded with a particular response. So I know this question was open, so people have been able to respond to it. As it stands, it looks like our top most recently used therapy is beta blockers. Behind that, it looks like devices like implantable cardiac defibrillators and pacemakers. And then maybe kind of a clustering coming in third with calcium channel blockers, antiarrhythmic medications, and blood thinners. However, we do have experience with all of the different treatments that are listed here, including some of you that have participated in clinical trials. It looks like we'll actually have some specific questions about that a bit later, and we'll really want to hear your experiences in participating in trials and your decision-making around that. And we do have some transplant or total artificial heart patients that have had to have those procedures. So if we go to our second polling question. So, we were just kind of covering different medical treatments and therapies, but we want to, kind of look a little bit more broadly. So we want to know what all, in addition to what was on the first slide, are you currently doing to manage the symptoms of HCM? And again, select all that apply. Your options here are A, seeking care at a HCMA recognized Center of Excellence program. B, following the recommendations of your HCM care provider to seek advanced therapies. C, lifestyle modifications, including at home, work, or in exercise. D, dietary changes, hydration, and weight management. E, counseling or therapy or stress management, also meditation or other kind of mindfulness or spiritual practices. F, self-education or peer support. Or G, if you've tried something else or do something else to manage your symptoms that wasn't listed either on the first slide or on this slide as a response option, please select G. We're very interested to also hear kind of unique or less common approaches to treatment. So again, please select all of the different things you are doing to currently manage your symptoms, all of those that would apply.
Quite an array here.
Yeah, it's looking like we're seeing, quite a bit of usage of all of these different approaches. We're seeing maybe counseling, therapy, stress management, meditation, and mindfulness is a little less common than some of the others, but still quite a significant amount for all of these. Not too many people are reporting other treatments, so I guess we did a good job of covering our bases on different approaches to treatment here in these options. But good to see that we have a lot of experience with getting care at centers of excellence, following recommendations for advanced therapies, other lifestyle modifications, diet, hydration and weight management, and also even self-education and peer support. So thank you so much for answering this. We have one more polling question at this time. Now that we've gotten a sense of all the different types of things that you are doing to try to manage your symptoms, if we go to our third polling question. We also want to know how, just overall, your assessment of how these things, these treatments and lifestyle choices have helped improve your quality of life. So if those things that you've tried have provided no benefit at all, select A. If they've helped somewhat, select B. If they've helped a lot, select C. If they've had a very significant benefit, select D. Or if you're not sure how much these treatments and lifestyle choices have helped improve your quality of life, you can select E for not sure. So select the category that best represents, how much these things have helped you, or if you're a caregiver, how much they have helped improve the quality of life of your loved one. We'll let you think about this.
I think somewhat is taking the lead.
Yep, we have, it's kind of floating right around that 50% mark. We're seeing 50% of the individuals with HCM that we have represented in our virtual audience today reporting that everything that they currently have has helped somewhat. We're seeing about a quarter of people saying that this treatment regimen overall that they have available today has helped a lot. About 14-15% saying very significant, and about 10% saying no benefit at all. It looks like very few people are reporting that they're not sure. However, there are some people that are reporting that they're unsure. So I think this is, we want to kind of understand your thinking about how you chose these options. When you tell us something helped somewhat, what did it help? How did you know that it helped? Can you give us an example of something in your life where you noticed that it helped? These are the kinds of things that we're going to want to get your input on. So thank you for participating in the polling. We'll come back, remind you to please call in, write in, and we actually have some callers in the queue that I'd like to engage and get their treatment experiences. So if we can first go to Michael from Rhode Island. He has called in to talk about his treatment experience, particularly with diuretics. So would love to hear from you, Michael. Are you with us?
Yes, I am.
Great. Well, please go ahead and tell us a little bit about yourself and this particular treatment experience.
Well, just briefly, I'm 39 years old. I've gone through the full progression of non-obstructive cardiomyopathy. So I just have a very thick heart muscle. I've had a septomyectomy. I've been on various medications, and now currently, I did want to talk about something that you hit home about, which is that, I get significant benefit, but also significant burden from diuretics, which I'm currently taking 100 milligrams of torsemide twice a day. And in addition to that, I take once a week metolazone, which is a diuretic booster. So, I take a significant amount. So I have to really watch my potassium. I have to really, be mindful of how much I have to go to the bathroom, which is quite frequently, like probably 12 hours a day in and out of the bathroom, which is difficult because I've got 2 kids and they're both very active. I have a son who has actually tested positive for a variation of the condition. He has non-compaction cardiomyopathy, which just means that the trabeculations in his heart haven't smoothed out. So, I need to be careful with him. He doesn't play sports, but he's still active in theater. So I try and live as normal life as possible, but it's not easy when you're taking that much diuretic and your life basically revolves around staying in the bathroom to stay out of the hospital.
Wow. No, that's, I think you've really helped me understand just how kind of disabling it can be on life and life activities to, have to manage with that. How long have you been on, these high doses of diuretics?
Probably about 2.5 years. So, I mean, it's progressed. Just recently, just before Thanksgiving is when they put me on the metolazone, and it helped a ton. But there are days right after I take it that, it increases my heart rate significantly. So I have to be careful, and then I've had to go for blood work routinely to check my potassium and magnesium levels.
Yeah, and how have you noticed that it's helped? Because you mentioned a couple times that, the diuretics have been helping you, even though they have these pretty significant side effects for you. How have you noticed them helping you?
Well, I mean, I've lost weight. It's given me more energy, just in that you don't have that burst, like you don't realize how much you can breathe until you can breathe.
Wow. No, that's incredible. Thank you so much.
Thank you,
Michael, for tuning in and for calling in and sharing. Just a reminder before we go to our next caller, who's Isaac from Maryland. If you'd like to dial in, you can call in at 1-703-844-3231. Like to go now to Isaac, who has family members with HCM, and he'd like to share some of their experience. So Isaac, are you with us?
Yes, I am indeed with all of you, and thank you so much for this opportunity. I am Dr. Isaac Rodriguez, and I am calling in as in a dual role. I am a caregiver for my wife who has HCM. I also am a father of my daughter who also has HCM and who is a young teenager. I happen to be in a unique position from the professional standpoint also because I'm a doctor in science who understands the medical nuances of HCM. And as a professional, biomedical professional, I understand clinical research and all the things that have to happen for new medical products to be in the marketplace and for HCM individuals to take advantage of. So I am evidently not a person that has HCM, but I live with people who has HCM, and my life and the life of my family have been impacted by HCM. At the personal level, I can share with all of you that I am always on guard 24/7. I am a supporter, I am a provider, I am a caregiver, I am a researcher for new medical advances, and I am an advocate for the HCM patients. What I hope to have for individuals, valuable individuals with HCM, is the following. First, early and accurate diagnosis and more treatment options so that we can have a better handle of the disease at the population level and provide improved quality of life for people with HCM. I really would like to see novel therapies that can stop the expression of genes responsible for disease onset and the progression. We know that this is a hereditary disease. Essentially, genetics drives this condition, and there is a lot that can be done from the genetic standpoint to prevent the expression of these genes that are responsible for causing the symptoms of the disease. I also hope for smaller and better medical devices with batteries that indeed can be rechargeable. We have improved the life shelf of these batteries, but we really need to move on to rechargeable batteries. And at the social level and the strategic operational level, I would want to see more of raising the level of awareness about HCM nationwide. Many people are undiagnosed or they just don't know about the condition until they get diagnosed later on in life. So we need to raise the level of awareness. I also hope for improvement and expansion of the centers of excellence across the nation, and create, if you will, a network of excellence in which people don't have to travel so far away, 2 hours, 3 hours, half a day, or a day plus, to get to these centers and be able to be taken care of. And I also would like to create or hope for the creation of a center of information and resources, or hubs that can share information about opportunities, possibilities, life options for people with HCM. Last but not least, I would say we need to work together. We need to create partnerships with the sponsor companies and with the federal government agencies to assist in the development of novel medical products for patients with HCM. People with HCM are wonderful, productive people, part of the society, vibrant people who have present, who have future, who have life, and people, caregivers living with them, are equally impacted. We are all one community. Thank you for the opportunity.
No, thank you so much, Isaac. I mean, I think your comments capture that there is a lot that's needed, for those living with HCM and for those caring for individuals living with HCM. While we're on this topic of treatments and different treatment experiences, I know we've been getting a lot of written comments coming in, so whether they're kind of personal takes on some things maybe that we've already talked about, or maybe even some unique treatment experiences that we haven't heard about. Lisa, can you share some of what's been coming in on the web?
I'm very happy to report that the web has been very busy. And Isaac, thank you for those wonderful comments. I agree with everything you said. Okay, so Ellen in Portland, Oregon was diagnosed originally with mitral valve prolapse, which is a very common thing for those with HCM. But when she was about 50 years old, she went ahead and had a myectomy, and it has improved her quality of life a great deal. However, there are still limitations. Myectomies are very good and can limit a lot of symptoms, but it doesn't take care of everything. You still have an abnormal heart muscle. So she's still battling with that. She is very interested in participating in clinical trials, and she is actually in one of the trials that is currently available right now. So that's fabulous. We have heard from Lisa from Springfield, New Jersey, another Jersey girl. Sorry, the Jersey girls have to call out Jersey girls. She has had a life of beta blocker and diuretic therapies, and life is far from perfect, but bearable with the medications. And today would have been her father's 73rd birthday, another birthday person today, but he passed away from heart failure at 73, so he didn't get to have his birthday this year due to HCM. So while there are things that are helpful, and there's that underpinning of that family burden and not being able to do things. Franklin, who's from Palo Alto, had his myectomy surgery and is undergoing evaluation for his HCM on a current basis, but his Center of Excellence helped him get his life back, and he's able to walk over 10,000 steps a day, and generally he's feeling great. Danielle is very happy that the ICD has helped her son have a second chance at life. So again, a success story with therapies. Unfortunately, we know that the ICD gives you that protection from that event, but you're still dealing with an abnormal heart muscle that could progress into something else later, and that thought is often in the back of people's minds. Andrea from San Diego tries to stay hydrated as best as possible. Those of us in the HCM community know how important hydration is, because dehydration is truly the enemy. So she tries to keep well hydrated in San Diego, which can be a challenge. And she has an SICD, so the newer devices, which are implanted on the side and not leads directly into the heart. So a lot of patients find the SICD a little bit more comforting because there's not leads inside of the heart, but in fact outside of the sternum. While it does have to power with more joules, it doesn't lead to the complications internally in your heart. So people are happy and people are sad. But I want to focus on one other comment, and then I'm going to kick it back to you for our Zoom panel. And that's Dominic, who had some really excellent points. And excuse my lack of eye contact here because I want to read him verbatim. Uh-oh, somebody just moved my screen. Sorry, hold on. As with so much of our life with HCM is spent on drugs, we're always Is there any way to add endpoints to clinical trials that are around quality of life, not just overall improvements, i.e. appearance, weight gain, hair loss, also adding some endpoints on emotional and mental well-being while on the drug, i.e. fatigue, depression? Understanding that there may be trade-offs in overall health to the benefit of the drugs, but to the extent that the quality of life can remain unhampered while being on the drug, that would be awesome. Less hair loss and less fatigue would be great too. So I think he kind of sums it up that we want new drugs, but we want some of those side effects of the drugs that are out there right now to be gone.
Absolutely.
Back to you.
Yes, no, that's great. And while we're not focusing specifically on endpoints in clinical trials in this meeting, it is, if someone's thinking it's important to measure in a trial, then I think it's fair to say that's something that they'd like to see out of a treatment.
Absolutely.
So to take it to our Zoom panel, again, we're still focusing on any treatment experiences that you want to share to help us understand how well it's...
Just give us a wave if there's something you want to comment.
How well it's worked, or if there's also a burden that you'd like to cover that we haven't covered, or you want to take your personal take on. I'd like to go to Amit on our Zoom panel to share any thoughts that you have as a caregiver of people living with HCM.
Thank you. And thank you so much for holding this event. I think it's incredibly significant to really share the experiences of patients and caregivers and really the effect the disease has had on us and on our lives. Just to give everyone a little bit of background, my father passed away from hypertrophic cardiomyopathy at the age of 45, and this was in the late 80s, and he left behind a young family. Following a long clinical downward spiral of disease, even with active management of the day. Fast forward a little more than 25 years, and we watched my brother's disease progress in much the same fashion. However, because of the benefit of 25 years, he was fortunate enough to receive a heart transplant and is doing very well to this day. So the effect that HCM has had on my family really catalyzed my participation with the board. I've been a board member for the past 14 years, and now I'm the president of the board of directors. I'm also a physician. I'm an interventional radiologist, and I specialize in minimally invasive procedures. So I wanted to talk a little bit about sort of the course of disease that we see, and that so many folks today have been fantastic at communicating. Oftentimes we see young patients with vague, waxing and waning symptoms. They manage careers and families and concerns about personal finances. And unlike many other disease processes, HCM often afflicts multiple generations of people at the same time, children, parents, and even grandparents. So as therapies are evolving, we've seen devices like defibrillators become mainstays of treatment. But these devices weren't originally intended for patients with long life expectancies. As we heard today, I mean, we had really a fantastic speaker talk about lead fractures and inappropriate shocks result in need for complex lead extraction procedures. And folks are not only left dealing with the effect that this has on their families' day-to-day activities, but they're also left sometimes wondering who's going to pay for procedures with inconsistencies in insurance coverage. So in addition to navigating insurance landscape, patients have complex multifactorial treatment teams with cardiologists, electrophysiologists, surgeons, and HCM centers. And quite frankly, we're fortunate that we've come so far, that we're complaining that we have so many specialists who are now there to take care of us. I mean, I think it's a fantastic problem to have.
Sure.
But treatments to date, and I think that this is really speaking to the significance of a meeting like this, have really focused on symptoms. They haven't focused on disease modification. That means that we've talked about arrhythmia management, obstruction mitigation, managing cardiac output. Treatments have included medications and therapies that were really developed for people with high blood pressure who've had myocardial infarction, who've had coronary artery disease, and heart failure from other causes. So while, again, we're fortunate to have options available, none of this has been optimally developed for the HCM patient. And I think that's one of the real benefits of having a meeting like this and having everybody here participating, is not just talking about the disease, but really conveying the importance of having some focus on, really altering the course of this disease for our patient.
Sure. No, thank you so much for that. I think you kind of very eloquently tied together so many themes of what we've been hearing from so many of our patients and caregivers. So thank you so much. To keep building, because we want to use every second that we have to hear from as many voices as possible. We have a phone caller. Before I go to Wendy from Massachusetts, I'll just remind everyone that if you want to phone in, you can at 1-703-844-3231. Now let's go to Wendy. Wendy, are you with us?
Yep. Hello?
Hi, Wendy. We'd love to hear about you and a little bit of your story and specifically any thoughts and views you have on treatment successes and failures.
Sure. Well, I was diagnosed with HCM when I was 24, but it has really been a part of my life, my entire life. My mom had HCM, as did her mother and 4 of her brothers. Both my children have HCM. My daughter was diagnosed at birth, and my son was diagnosed when he was 15. At the age of 6 in 2009, my daughter had open heart surgery to help with some of the symptoms that she was experiencing from her HCM. And 2 days after my daughter's surgery, my mother passed away from complications of a heart transplant that was necessary because of her HCM. Hers was the 7th transplant in our family. I had to leave my daughter's bedside and leave her alone in the hospital so that I could be with my mother when she was taken off life support. And that's a decision that no one should ever have to make. I stressed the word symptom earlier because at this point, any intervention for HCM, whether surgical or pharmaceutical, is really only to help the symptoms. And as the previous panelist mentioned, every medication on the market right now is designed for something else, and they all have side effects. I'm currently on 5 medications that combined have me taking 15 pills every day. Currently, my daughter's only on 1, but it's an anticoagulant due to atrial fibrillation, which is far from typical for a 17-year-old and has meant that she's had to give up some of the things that she likes to do, primarily riding or horseback riding, because obviously being on a blood thinner can be dangerous if she were to have a fall. And the symptom relief surgery that she had when she was 6 damaged her SA node, resulting in later 4 cardiac arrests when she was 14. She's now fully paced by her pacemaker. The current treatments just aren't enough. As patients, we've become accustomed to the thought of only ever being able to get treatment for symptoms, and we've lived with the risks of ups and downs and extreme complications for years, but we're really tired of that. We want more than just symptom relief. We take risks every day, and we're not afraid of taking more risks, but we need real benefits, not just Band-Aids. And I want my kids to not have to make the sort of decisions that I've had to due to my HCM. I never want one of them to have to witness their child going through CPR in an emergency room, and I want them to have more hope than I feel like I have been able to have thus far in my life. Wow. Thank you.
Thank you, Wendy.
Oh, thank you. That was incredible and very, very insightful to help understand, that there is a tremendous burden, and these tremendous burdens are being kind of accepted in order to just get that symptomatic relief, as you put it. So a closing word on this set of discussion questions I want to give to Mark on our Zoom panel. Any final thoughts on any other treatment approaches, anything that's worked well or downsides that you would like to share with us, Mark? Oh, Mark, you're on mute.
Unmute.
Just like the last caller, there's a lifelong burden that we are all dealing with. And I think it's important that there's an emotional toll that we're actually taking. And it's be nice that actually is looked at because it's not going to help us to be worried. It's not going to help us to have stress like that. And anything we can do to alleviate that is, I think, positive. Early on, when I was diagnosed, I'm adopted, so I did not know any of my genetic history at all. And I did find out when I was 47 that my birth father died suddenly at the age of 48. And he died, well, how should we put this? Having fun. And that just was, it was a constant fear of mine, and started me on my road to, looking for professionals to help me. Early on, because of his history, it was decided on I get an ICD installed. And probably about a half a year later, one of the things that we tried to do, and I think this is a common procedure, is to adjust your ICD a little bit to relieve stress on the heart or to manage it, what it's doing. It really, I guess what they've have decided is it's not really an effective treatment at all, but it's something that's worth trying. Just like we have to go through all this medication, and I can't tell you how many times, I counsel people on HCM, and I hear horror stories of people who have spent years with different types of medications, combinations of medications, diet changes. They're trying everything possible in order to find it. And I think one of the things that's really helpful is if they're seeing a professional, and this professional can help guide them with that. Because if you are changing your diet, if you're doing meditation, if you're doing exercise, if you're trying to relieve stress like this, and you're trying to do other things, is it the combination that's doing it? Or is it one single thing that's helping more? And I think the more research we have done is going to, give us some answers to that.
Yeah, a real challenge in a world of polypharmacy where you're, not quite sure what's contributing, and that could really be both on the good and the bad, honestly.
Exactly.
So we have some polling questions. We know in conditions where you all have described so far a great, unmet medical need that exists, that there's a need for new treatments, and the way that we get to those new treatments is through clinical trials. So we have a couple of questions on clinical trials to understand your experiences with them, and so if we can go to our fourth polling question, and also then what you would consider in terms of participating in clinical trials. So here, again, pull out your phone, go to that web browser. You can see the URL at the top of the screen. We want to know, have you participated or wanted to participate in a clinical trial with an experimental treatment for HCM? No, you've never been asked or informed of one. No, for other reasons. It was B. C, yes, and you have enrolled in a trial. D, yes, you've tried to enroll in a trial, but you did not qualify. E, yes, you tried to enroll, but trial enrollment was closed. F, yes, but you did not want to enroll to the burden, due to the burden of the trial, such as travel or the potential risks. Or G, yes, you did want to participate, but you did not want to enroll for other reasons. So please let us know if you have participated or if you've wanted to participate, and if yes or no, why it is or how you did participate. So please select the response that applies most accurately to you or your loved one's situation. So while results are trickling in, it looks like the largest, perhaps unfortunately, the largest experience is that no, you've never been asked or informed of a clinical trial. So great opportunity to, improve on that to increase the number of people that might participate in trials. It looks like we have about 20% of people represented that have enrolled in a trial, or another 20% that tried to enroll, but they did not qualify. And then we have some experience with each of the others, of either people that did not participate for other reasons, they didn't want to, and it was for other reasons other than not knowing, or they did want to, but they didn't because of the particular burdens of that study, or because trial enrollment was closed, or for other reasons. We go to our fifth polling question. So whether or not you have participated in a trial in the past, we'd like to know what you think about the importance of different factors that might influence your decision to participate in a trial. And we'd like you to select your top 3 most important factors that would influence that decision. So your options are here: A, how the treatment might improve your health; B, the promise to receive that investigational drug at the conclusion of the study; C, the reputation of the study's principal investigator, that's the doctor that runs the study; D, proximity of the study site to you, or the need to travel to that site. E, the availability of safety data prior to your enrolling. F, concern over common side effects. These might be things like loss of appetite, insomnia, low libido, tiredness, or nausea. G, your concern over risks of serious side effects such as cardiac or liver issues. H, the way that the treatments are administered, whether it's orally, intravenously, or by injection. I, concern over required hospitalization or doctor visits needed. J, the cost, what expenses would be paid as part of your participation. Or K, some other factor that's not listed here related to your decision to participate in a trial. And please select your top 3. So I know there's a lot to consider there in terms of what would be the most important. I'm sure many of these are important to you. As it stands, it looks like the largest proportion of patients that are represented today in regards to how the treatment might be able to improve their health. So what is that prospect of benefit to you? And then after that, it's a concern over the risk of serious side effects, things like cardiac or liver issues. Although there's quite a number of you that ranked in your top 3, the reputation of the principal investigator, the proximity of the study site and need to travel, as well as the availability of safety data. Everything on this list has been selected, so very interested to hear any thoughts that you might have of why you selected the things that you did. And maybe to get us started on that, we can go to our Zoom panel. And so if maybe I can put Scott on the spot, when you were looking at that list of factors to consider, what were the things that were most important to you and why?
I think obviously are just the side effects, cardiac side effects, anything that may impact you in a negative way. I'm not, given what I've been through with arrhythmia issues and all that sort of thing, I'm not too eager to volunteer for something that may provoke those things, having been through them already.
Sure. Linda, would you like to maybe also chime in on this? What did you think was most important if you were to consider participating, and why?
Definitely what the overall improvement could be on my lifestyle, the effects that, improvement that it could give me.
So it would be specific things, if it lined up with the needs that you have in terms of resolving symptoms or health effects. Is that what you mean?
Yes. Kind of mirroring what some of the other comments were about specific drugs out there today don't specifically address a lot of the symptoms that I have. So if there was a drug out there that could address some of those symptoms, would be something that I would want to try.
Absolutely. That makes a lot of sense. And I think your 2 pieces of input align with what we heard as the top 2 from that polling question.
Absolutely.
Did we happen to get any comments around clinical trial participation from the web?
I believe I covered one earlier. I'm sorry, I'm going to go through that. I can tell you that I personally have been involved with at least 9 clinical trials for medications over my life.
Wow.
Some of them never made it to market. Other ones did. And I was very happy that I was able to participate in that. My sister was a clinical trial participant before her passing. My daughter, my niece have been clinical trial participants as well. So if we want to make it better for the next generation, we certainly need to put ourselves out there and take a little bit of a risk. Unfortunately, I think I've lost that message here. I think I covered it before.
So I'll ask you a follow-up question.
Yes, sir.
In thinking about all of those clinical trials, what were the key considerations for you? What was most important? Like I said, many of those probably are, but.
Well, I think my dad plays a role here. He's where my HCM started, well, his line of the family, and my dad was a fireman, and he tried to help other people. And if there was something that we could contribute to the overall cause to help others, that was kind of ingrained in me at a very young age. Yep. So we very often went to, look at these clinical trials, as long as there was no crazy side effects or really unseen issues that were going to put my health in jeopardy. I was pretty willing to say, yes, I'll do it. And I've been involved with the dual chamber pacing, which Mark alluded to earlier, trial. That one did not go so well. I've been involved in drug trials. I was in the eleclazine study, which I thought was going to go well, and it didn't. I've been involved in imaging studies and lots of other studies. So if I can give something so that my kids, my niece, my nephew, my daughter have a better life, then I'd be really happy about that.
So that's a big motivating factor.
Family's a huge motivating factor for myself and a lot of people. I can look at this screen of Zoom callers, and I know it's a big factor for them as well, and many other people that I work with. We want our families to have a better shot than we did.
And Biller, did I see you raise your hand there?
Oh.
Yes. Love to get you to weigh in on this as well.
I'll go back to. Unmute.
Oh, we can't hear you.
We can't hear Biller.
All right, can you hear me now?
Yes, we can.
Thank you. Okay, one of the comments I wanted to make, it's not the unwillingness to participate, but there has to be, and it was in one of your questions, sharing information with the patient. These are not lifestyle drugs that we are, volunteering, if you will, for clinical trials, etc. There lies a big responsibility of the manufacturers also to involve the patient and their care and follow-ups. These are all necessary inputs for developing safe, efficacious, and tolerable medications. So we are not, excuse my term, we're not lab rats helping to get a product to the market. These are diseases, as I mentioned, in our previous conversations. All of us have multiple comorbid, other issues. Every minor change you make could be a debilitating issue for the patient. But what is the care that's being provided? All of those have to be better regulated. Regular patient input has to be taken, and there has to be also a regular follow-up. There are clinical trials and the related stories that I have also followed personally in my previous, career environment. Actually, there are patients who feel at a complete loss of what happened, why they're experiencing certain things. So as all of us are willing naturally to make other young people not to go through what we're going through or have better outcomes from their medication, one of the things that has to be there is a better follow-up, explanation, education with the patients who are participating in it. And I did not choose in my options, but there has to be also, if a patient is benefiting from the drug that they have been on trial for, that drug should be made available to that patient even when the study is over, so they can continue benefiting and improving what they're going through with their own disease.
Sure.
So I just want to make those comments.
I'm going to follow up on what Biller said there for a minute. This is a collaborative. We're the patients. We're the patient advocacy organization. There's drug developers, there's FDA. I was very happy to be a panelist at the last last FDA clinical trial training program to explain to industry how they can work directly with patient advocacy organizations to help in the recruitment and the communication and the engagement of the said community. If we can get these communities to all work together and realize we're all on the same team, we are all here together, and we all need to work together to make sure that there's timely registration in clinical trials, that there's appropriate follow-up. When a patient says, I'm in, that they're in. Because if you start and then you drop off, we lose so much effort there, and there's a lot of money wasted and a lot of time. So if we all are on the same page and we all work together to get people to engage in clinical trials that are well-designed, safe for the patient, and really look like they're going to have a good potential for getting to market, we want to be there. We want to be the partner of those drug developers. We want to work with the FDA to make sure they really understand us like we're doing here today.
Yeah. So on that note, I need to take us, since we have limited time, to our final question, which is an important one.
We're getting there already?
Yeah, I know.
I could do this all day.
So we've talked a lot about current treatments and treatment approaches. We talked about clinical trials. To some, that may be, one of the treatment approaches. Well, we want to talk also about future treatments. And so, we posed that question about short of a cure, what is it that you would look for? Well, we have a polling question on that. So if you pull out your phone, go to the web. This is our last polling question of the day. Hopefully you're still with us strong and can give us your input on this. So considering your current health status, which symptoms would you most want a drug or a treatment in the future to eliminate or improve? Please select the top 3 things that you would want the treatment to help with. Your options are A, advanced heart failure, B, chest pain or pressure, C, shortness of breath, D, heart murmur, E, lightheadedness, dizziness or fainting, F, arrhythmias or palpitations, G, sudden cardiac arrest, H, fluid retention, I, exercise intolerance, J, weight loss or gain, or K, other.
Again, no surprises in how this is filtering in. While we're waiting for this, I'm sorry, what? Yes. While we're waiting for this, I wanted to comment on some of the write-ins that we're getting. He's provided his name, so I'm going to say that the brother of one of our panelists is on the line. And he comes from an interesting perspective because he's a physician in the field. And this is from Eric Popchis from Hershey, Pennsylvania. And he says, it's good to hear all these stories, but he wants to mention that the majority of patients with HCM have good quality of life and don't have a lot of complications. And these bad clinical courses that we're talking about aren't the masses. They are a percentage of our population, and I want to acknowledge what he said.
Sure.
And he also stated that many feel very well, and he's included himself in that category. So, these family histories can go all over the place, and we can definitely look to them for some guidance. So additionally, we have a couple of other comments coming in. Tammy wanted to talk a little bit about how her echo made the difference between a diagnosis of a mild HCM to an obstructed HCM. And she went from you're fine to a cardiac cath to needing surgery and being on very high doses of beta blockers, then going on to have an ablation and an ICD. So the atrial fibrillation was a problem for her, and her short runs of VT were problematic as well. And she had to go through community-based cardiology to get to her treatment pathways, so that creates some challenges there. We've got so many other comments that I could probably read all day, but I do want to mention one other one from Amy. And unfortunately, Amy, I know where she is right now, and she's in the hospital right now. She's a post-transplant patient who's now managing some issues with anti-rejection medication that have to be balanced out. But what her real hope is that there would be better drugs to treat the native hearts that these HCM patients have without having to go to transplant and having the complications of transplant as well. Because while my heart might be sitting here and others have transplanted, this does not mean that we're not at risk for drug interactions, advanced cancers, and other issues that we relate to when you're an immunosuppressed person. Yep. So transplant isn't a get-out-of-jail-free card. We just get to go to a different jail cell.
Right.
So we need to worry about that as well.
Thank you, Lisa, and thank you for everyone who's been writing in. So we've got those polling responses in now. The top thing that is being asked for, I think it's very consistent with what we heard from the things that are burdening you the most this morning, is that we're really looking at shortness of breath, some help with that, followed by, help with arrhythmias and palpitations, exercise intolerance, and advanced heart failure. Although there's not a single thing on this list that isn't in someone's top 3, so important across the board. So just for some final comments on that I noticed from the web, and it's really, I think, echoing what we've heard so much throughout this entire session, so it'll really be kind of the final words on this, is Cynthia from Los Angeles talked about, wanting to lessen the impact of the disease, the fact that there aren't things that, fully address her symptoms. There's someone else that, talked about the need for treatments that directly address the disease rather than are for other symptom or for other conditions that are repurposed. And then a final comment that came in from the web mentioning that there needs to be less toxic side effects. So I think that's really those trio of comments really well summarize what we've heard. So with that, that concludes our portion of the program where we're getting input from all of you. It's been an incredible day. As your moderator, I am so grateful to have had Lisa and our panelists, our Zoom callers, every written and phone caller in today. We've really achieved what we were setting out, which is to hear from all of you about the burdens and impacts. You have, for me at least, really pulled back the curtain on what it means to live with hypertrophic cardiomyopathy. You have helped me understand that it's not just a disease of the symptoms and the health effects and the worries for the future, but a disease that comes with a whole extra set of burdens from all of the treatments that you experience. And I know that it's not easy to talk about those negative aspects of living with a disease. We all want to be hopeful. We all want to think about the cure. But today we had a mission, and thank you all so much for helping accomplish that. I just want to mention, if you're leaving today, you feel like you haven't had that chance to share everything that you wanted, or you're going tonight, you're laying in bed and you think, oh, I wish I had called in and said something. That comment box that you've been able to type into all day, that will be open for 30 more days. Everything that you put in there will be considered. And if you happen to be watching this on demand, you're watching the recording, you didn't have a chance to tune in on my birthday, June 26, and be with us, you still can participate as well. There will be a post-event survey link that will be added starting, I believe, on Monday below that, the replay. So you'll be able to participate in many of all of the same questions that we went through live today. And again, all of those will be included in the Voice of the Patient report. So this is the point of the agenda where I say farewell, but I have the privilege of introducing our speaker that's going to provide some summary comments, my friend and colleague, Larry Bauer. Larry is a real champion for rare disease patients. He spent 17 years at NIH, where he did research as a research nurse. He then went to FDA and, among other things, co-founded the Rare Diseases Program within the Center for Drugs, where he worked then for 10 years and has been a true member of our PFDD team and worked with us to help plan this. So without further ado, Larry, we're looking forward to hearing what you've got to say about what you heard.
Great. Thank you, James. Thank you, Lisa. It's been an incredible day. I also want to echo what you said, James. Thanks to the entire HCM community for the courage and the willingness for everyone to tell their stories and to really share from the heart, so to speak, to try to really, capture what it's like living with HCM. So I've been given the task to try to summarize everything we've heard in about 5 minutes. So I'm going to go through this fairly quickly, and I'll just try to hit some of the highlights from some of the things that we've heard today. So we started out hearing that hypertrophic cardiomyopathy, it's a serious and potentially fatal disease. And the major symptom is left ventricular heart hypertrophy in the absence of other cardiac disease or other systemic diseases. There's a wide variety of genes, maybe 13 different genes, and it can affect, even though there's 120,000 people that have been identified, they think it might actually be affecting as many as 750,000 people in the United States. One of the trademark characteristics of this disease is that it's familial. I think that was one of the things that impressed me the most when I hear the stories of how densely some families have been impacted by this. It's really just overwhelming, has been overwhelming to hear about that. So HCM, it's the most common genetic heart disease. It has heterogeneous presentation with a variety of genetic variations and over 3,000 mutations. It's a common cause of sudden death in young people. It can cause stroke and heart failure at any age. It's often diagnosed in midlife. And there are two major types, the obstructive and non-obstructive forms. It's typically diagnosed early in life, but can be diagnosed at any age. And in our survey today, it looked like about 29% of the people said they were diagnosed between the ages of 31 and 50. People with HCM are at risk for sudden cardiac death, progressive heart failure, atrial fibrillation, and stroke. So then we moved into our panel one topic about what are the most important symptoms people experience and how do those symptoms impact their lives. As we said, this disease is multi-generational. Sometimes it can start with something like just a murmur. It sounds like some people were found out like through routine screening where, you know, a nurse or a doctor picked up something doing a heart examination. Characteristics are cardiac arrhythmias, palpitations, and murmurs. These can be overwhelming, unpredictable, and terrifying. It's like they're always lurking in the background. These things impact career choices, and I was impressed by one woman saying that she actually, trying to keep with her job, she slept in her car during lunch hours just due to the fatigue. Another very descriptive phrase was that what a person described as having one foot on the accelerator and one foot on the brake as you're trying to negotiate life with HCM. Some of the other main symptoms are fatigue, chest pain, which can be severe. Sometimes it was described as burning. A key symptom is shortness of breath, especially on exertion or going up any kind of hill or incline. People feel their heart racing, and they get headaches. And another key symptoms was dizziness. People said, I'm tired all the time. And I remember one person at least saying that they have brain fog. A serious impact of this disease is sudden cardiac death, cardiac arrest. And this has led in one case to someone needing to be put into a medically induced coma. People have had to take medical leave from jobs. And sadly, the cardiac arrest can occur even in very young people. We heard of someone that was 13 years old that experienced cardiac arrest. Symptoms can come out of nowhere, so they really impact people's lives, jobs, and families. It affects activities like going out on hikes, bike rides. They impact relationships, they impact mobility, and they can even affect the person's ability to drive. We heard someone questioning that someone with an ICD, whether, you know, they felt comfortable driving again. Another key thing that came out was some of the psychological effects of having HCM, that there's people experience anxiety. You know, am I going to experience a cardiac arrest? They have sometimes a sense of impending doom or terror. People talked about having a post-traumatic stress like syndrome, and that can be both for the individual that has HCM as well as their family members when they witnessed, you know, a parent or a loved one having a cardiac arrest and waiting for an ICD to kick in. Several people have suggested getting a therapist, that they thought that the therapist was a really good move, that it's helped them to deal with the stress and anxiety and to talk about some of the issues related to HCM. And then the second panel we moved into in the afternoon, we talked about current treatments and hopes for the future. Some people are making dietary changes. It sounds like everybody needs to think about hydration, try to get a good night's sleep, trying to have exercise, doing Pilates and other forms of exercise to keep up muscle strength. And the goal of these things is to increase energy and to try to stay as healthy as possible while you're dealing with HCM. People are using a wide variety of drugs that include beta blockers, diuretics, calcium channel blockers, anticoagulants. And these drugs, people have made the point that most of these drugs were developed to treat other diseases and not specifically HCM, and that almost all of these drugs have serious side effects that affect people's lives. They can cause fatigue, they can cause brain fog, and sometimes people have to go to continue with follow-up blood tests to monitor liver function and things like that. There's several types of more invasive procedures, such as cardiac ablations and the alcohol ablation. Myectomy, we heard many people talk about myectomy as a treatment to decrease the cardiac actual thickening of the muscle. But this is a very major surgery. It's painful, can cause blood clots, infections, and it can provide relief for people, but it also can have side effects. One person talked about having a sternal non-union afterwards. And for some people it was effective, and for other people not as much. And we heard that about 3% of people with HCM actually progressed to needing heart transplant. And then as many as 30% of the people have implantable cardioverter defibrillators, ICDs. So this is very common. And so one of the side effects of this is that they can fire at inopportune times, including like being at a wedding or an important life event. They can be distressing to people to have it because you don't know when it's going to fire. And I remember one gentleman saying that it felt like a horse kicking him in the chest when it fires. But at the same time, the ICD, we've heard again and again how they have been life-saving. One person said that if I had not had the ICD, we'd be planning my funeral right now. As far as clinical trials, some folks have participated in clinical trials with varying results, and people talked about, their concerns about wanting to be in a trial, especially if there are any kind of serious side effects that might happen from being in the trial. Thinking about what people would like to see in the future, the current treatments just aren't enough. People said they would like to be able to travel more. They would like a portable monitor for the ICD. They would like to, we heard a little bit about the effects of HCM on pregnancy. So maybe for women to have more counseling if you have HCM, and you plan to have children. People said that a weekly drug would be ideal, and they overall would like to see drugs with fewer side effects. People mentioned that they would like to have drugs that really treat the symptoms, that especially fatigue and breathlessness. And regarding some of the devices that are being used, people would like to see smaller devices and have batteries that last longer and devices that are more mobile. And rather than just having symptomatic treatments, people would really like to see disease-modifying treatments in the future. And one of the overarching things that we heard is that everyone's looking for a better quality of life to live with HCM. So thank you very much. And for some closing remarks, I'd like to turn it back over to Lisa to close the meeting for the day.
Thank you, Larry. Really appreciate that. Well, ladies and gentlemen, we've made it to the end. COVID didn't stop us, and neither did technology, so we're really happy about that. I would like to take a few moments to give some much deserved thank yous to James and to Larry, who have helped coordinate these meetings for not only us, but many other people. They were a dream to work with. To my AV team behind the cameras, Dudley, you guys were fantastic. Could not have made this happen without you, so thank you there. To the staff of the HCMA, Carolyn and Donna behind the scenes, Valerie, Ella, Lisa, and who else did I miss? Julie, our newest, everybody. Thank you back in the office for letting this happen the way that it did. To our message board moderators, our Facebook moderators, our panelists, our Zoom people, the fabulous patients who took their time out to do videos and practice them and send us pictures and share their beautiful families with us so that you can understand our burden. Thank you, everyone. Thank you to our sponsors again, Myocardia and Cytokinetics, for providing the financial support to make this happen. And I want to just go over a couple of key items before I close out this meeting. Hypertrophic cardiomyopathy, obstructive, non-obstructive, apical, mid-cavity, we're all one. We all need your help. We all need to be focused on looking at better drugs with less side effects that help us live our lives the way we want to live them. If you came in late and you came to the lunch break and you saw Claude Brady, that is the definition of inspiration in HCM. Diagnosed in 1959, and he was sitting in the studio yesterday with me. He's 83 years old. HCM does not have to shorten your life. It can be long, it can be prosperous, it can be happy. Don't think it has to be negative. You will have 30 more days to comment on this, and I expect to read lots of comments. It will all be used in our Voice of the Patient report. and that will be submitted to the FDA hopefully in the fall. I do want to take one last moment to encourage you to join us online on social media, Facebook, Instagram, Twitter, or on our website, which will be upgraded very soon. And my closing remarks are, and I'm going to cry, to my daughter Becca, to my niece and nephew John and Stacy. This is for you guys. May your future be bright, and may HCM not cause any more trouble in your life or in any of our other fabulous families with HCM. And if you've learned something today, you understand why I have committed my life to these amazing families. They deserve better. We can do better, and together we will. So thank you all.